Good morning, friends. Wash your hands. These are perhaps the three most important words the world has heard since COVID-19 breakout, the worst pandemic to hit the world in 100 years. And interestingly, this phase also brought the most phenomenal change in our behavior, with billions adopting this practice in a quest to protect themselves and the people around them from the deadly virus over the last 2 years. However, the message was not new, as most of us have been brought up hearing this from our moms at home to teachers in school. Still, surprisingly, washing hands regularly and washing them rightly remained among the most neglected practices, even though this alone could have helped in preventing several diseases that still take a heavy toll on our health and lives, and especially that of our children. While lack of proper hand hygiene among many living with modern amenities had been a behavioral and awareness issue, for millions not washing hands properly and regularly has been a way of life, not because choice, but because there has been no running water or soap for them. The National Family Health Survey 4, which was conducted in 2015 and 16, highlighted the grim situation of hand washing in the country. According to the survey, while almost all households in India, and which is the estimation says as high as 97% of them having wash basins at home, only wealthier and more educated families in urban areas use soap to wash hands. The survey also pointed out that only 2 out of 10 poor households use soap compared to 9 out of 10 in affluent families. The World Health Organization states that hands are the main pathway of germ transmission, and thus hand hygiene is the most critical measure to avoid the spread of infections and keep people healthy. However, the poor hand hygiene practices have been costing dearly to India, putting it at par with sub-Saharan nations for death under 5 due to preventable causes. According to National Health Mission data, around 1 lakh children die from diarrhea in India every year. Also, if diarrhea is not killing, then the repeated occurrence of this disease and other intestinal infections trigger child undernutrition, another major cause of death under 5 globally. WHO attributes nearly 50% of cases of child undernutrition to repeated occurrences of diarrhea. And according to WHO, about 241 million children between the age of 1 to 14 years in India are at risk of parasitic intestinal worms. That is about 68%, or 7 out of 10 children in this age group are at risk of such infections. And this, along with other significant diseases such as cholera, typhoid, and even hepatitis A, also can be substantially reduced just by improving hand hygiene. So while we can now fathom the damage caused by just not having good hand hygiene in masses, lack of hygiene is adding to people's trouble in many other ways. One such concern is healthcare associated infections, HAIs, affecting hundreds of millions of patients globally. WHO highlights that ensuring appropriate hand hygiene can prevent up to 50% of avoidable infections acquired during healthcare delivery, including those affecting the healthcare workforce as well. So to understand multiple factors that impact adoption of this critical practice and what role governments and the leaderships can play in making hand hygiene a well-supported norm, we at ISW Council are back with the second edition of Hand Hygiene Summit on the occasion of World Hand Hygiene Day, which is observed on May 5. So we have a panel of esteemed speakers who have promoted hygiene as their life mission and diligently works towards building a Swasth and Ayushman Bharat on the solid foundation of sanitation and hygiene for all. So let me welcome Dr. Ramaranjan Pati. He's a director of All India Institute of Hygiene and Public Health in Kolkata. Dr. B.N. Majumdar is joining us, honorary chairman of International Academy of Environmental Sanitation and Public Health in New Delhi. And Dr. Alok Kumar Deb, scientist at ICMR, National Institute of Cholera and Enteric Diseases in Kolkata. And also joining us, Mr. Ravi Bhatnagar, Director, External Affairs and Partnerships Asia, Middle East for Reckitt. And I am Kamal Narayan, CEO of ISW Council, India's premier institution for health awareness, advocacy, and behavior change. So thank you all our speakers, those who have joined us and those who will be joining in some time. Dr. Ramaranjan Pati, let me begin with you. I tried to bring together some facts and figures related to the burden on public health because of a lack of hand hygiene. You are heading an institution which is working in the area of hygiene and public health, and the interplay between that. Dr. Pati, what is the really a challenge in terms of lack of hand hygiene in our country, and what impact it is making on the health of the people, and what we can change if we change this practice, which we have seen largely being adopted during the COVID-19?
Good morning, everybody. Actually, the main obstacle, what we see is that we have the knowledge. Knowledge is there. We know that hand hygiene is important. Proper hand washing prevents infection, prevents the transmission of infections. But the problem is, this knowledge doesn't reach the community. Many people are not aware about it. Many people, some people are aware, but they don't have the habit. So first thing, to make people aware and to make it a habit for them. So this is the challenge we face. Otherwise, so what we can say is, the challenge is in taking the knowledge to the community, to take the knowledge to the people. So this is the challenge, and the consequences many people are facing, because if you go to any community, you find that the two infections are the commonest. One is respiratory infection and one is diarrheal disease. And a major cause of this diarrheal disease is this transmission of infection due to lack of hand hygiene. So this is the main problem our people are facing, and diarrheal disease, worm infestation. So all this can be prevented to a large extent if all the people they practice this hand hygiene, proper hand hygiene.
Sir, one follow-up question also. Proper hand hygiene is important. It is leading to certain cause of infections which are taking a big toll. I figured kind of mentioned some numbers. As a public health expert also, who understand that how hygiene can play an important role in the public health outcomes, how do you see, are we creating enough, infrastructure or enough, access to all these important things? Because if you want to wash your hands regularly and properly, you need to have, running water. A certain quantity of water has to be coming at your place, and we have seen even in healthcare facilities in India, and especially at a primary level, many times don't have that kind of facility. Which contributes to certain kind of infections being passed on even in hospitals. So how do you see that this particular behavioral change can be kind of obtained by adding certain infrastructure, certain maybe policies? What is your opinion on it?
Actually, this issue is multi-sectoral, and only with the healthcare providers we cannot do much about it unless the other sectors are involved. Like very rightly you have said that running water is very essential. So unless running water supply is there, not much can be done. And in many places in our country, they face water shortage. So when there is water shortage and people walk miles to fetch water, so there, we cannot expect hand hygiene. Even if we teach the people, it will not be of much use. So it's a multi-sectoral approach. So the water supply department has to do its part. Then we have to do our part. So then only this problem will be solved. Otherwise, I mean, there is no point going and telling the people that you wash hands before taking food, after going to toilet, all these things. So they will say, when we walk for 5 kilometers, 7 kilometers to fetch water, so how much water can we carry? So that is one issue. And in our institute, we have a field practice area, one rural field practice area and one urban field practice area. We always say that the communities, our field practice areas are our laboratories. We have laboratories, but then we refer to our field practice areas as our laboratory, because we consider that area to be our laboratory, and our workers and our students, they go to the community, and every year they go to the community, they find out what are the health problems they are facing, and they also teach them hand hygiene, they teach them the proper steps of hand washing, and we use different forms of teaching, like through songs, through drama, even we arrange some magic shows. So to make people aware and to change their habit. And only creating awareness is also not enough, because everybody knows that morning walk is good for health, but not everybody goes for morning walks. So it's a habit, and for that we have to make the community aware, and so that, because otherwise if we just teach few people, this program will not succeed. This is what we have seen in the community from our experience. So many people have to adopt this practice, then only it will have a lasting effect.
No, absolutely. I think that's a very important aspect. And as you said, even in schools and in communities, you are using a lot of activities, including magic shows, to kind of drive the point. I think people must understand that just hand hygiene itself is a very magical practice, which can help them protect from multiple diseases and even the loss of life. Let me go to Dr. Alok Kumar Dev. Dr. Dev, you are part of an institution which is working on the area of cholera and other enteric diseases and all, and I'm sure diarrhea would also be part of that. So let me go to more specific. What is the the actual disease burden? What are the figures coming to your institution, and what are the important interventions you feel to be taken for managing this?
Well, yes, our institute is mainly concerned with different kinds of enteric diseases, and that's why hand hygiene and also along with it water safety and sanitation, they are our priorities. So we work a lot on these issues, not only research activities, but also promoting these things in our communities. We have a regular surveillance for diarrheal diseases, specifically since you asked for diarrhea. Surveillance for diarrheal diseases, which is running for last more than 25 years. So we have a lot of data, and the data shows some very peculiar things. That whatever we are getting is that there is a drastic change in mortality from diarrhea over past several years. I mean, very serious. I mean, it has lowered tremendously. But as far as occurrence of diarrhea is concerned, it has remained almost at a static level. So it shows us that we have been able to manage diarrhea well. People now know, even the common people, they now know the what is ORS or homemade solutions, all these things, and they start treatment early. So we can manage them well and prevent deaths. But when it comes to occurrence of diarrhea, it is still almost at the same level, which indicates that the factors that cause diarrhea has not changed so much over the years, right? And the most important factors that cause diarrhea in the communities include hand washing. Along with other things like safe water supply and adequate sanitation measures and all these things. But hand washing and hand hygiene is a very important point. And when we do the research and other surveys in the community, we sometimes find very interesting things. As Dr. Poti was saying, that many people have the knowledge or the awareness, but translating it into a positive attitude and then real practice is not happening. And I would, I mean, since I am in this forum now, so I would like to highlight a word of caution that when we do these surveys and we get some figures about how many or what percentage of people do the hand washing practices rightly and all these things, many a times these are actually overestimates. I can share some of my experience in our communities when we went to the communities and asked the households that whether they practice hand washing, say after defecation, before child feeding, and say before taking food and all these things. And it was in the urban slum areas. So almost 100% of them said that yes, we do practice it, and most of them, more than 90% of them, they told us that we use soap with water for hand washing practices. But then when we asked them, could you please show us the soap that you use for hand washing after defecation or like that, at least 10% of the households could not produce the soap. Okay, that means they are aware, and the responses they give what we call are socially desirable responses. Okay, so I mean, when we get these percentages, so I am a little bit cautious that it is still, I mean, the numbers are still less, but still it is some overestimate, I think. So we have a lot of way to go, I mean, and a lot of things to do. As you are also mentioning, whether we can have some maybe but innovative methods, innovative techniques or something to overcome this problem. That means translating awareness to practice. No, I can give you another example from a very rural area in one of the districts in West Bengal. And when I say innovation doesn't mean that it has to be highly technological innovation. It can be even some very basic thing, very simple thing. So what happened that we were visiting some of the ICDS centers in one of the districts. So in the rural areas, when we went to one of the ICDS centers, it was around noon time. So the Anganwadi worker was there, the helper was there, and 10 or 12 little kids were there playing with some blocks and all these things. And we were asking some questions to the Anganwadi worker and all, and she was also cooking midday meal for those little kids, right? So at one point, she told the kids that, well, boys, just pack up your things, the meal is ready. Okay, so instantly the kids packed up everything, and then they took out some small steel plates where the meal would be served. Okay, then they formed a nice queue and went outside where a tube well was there, and they placed all their plates, I mean, around the tube wells, and then the helper came out and he put one pinch of detergent on each of these plates, and she then pumped the tube well, and one by one the kids, they washed the plate with the detergent, and when they washed it, their hands also were washed, right? So I found it very amazing. Just a simple thing, No, and that detergent was the lowest, probably the lowest cost detergent that would be available nearby. So, I mean, I thought it was very innovative idea that the Anganwadi worker got. So, I mean, even with some simple things, we can probably change these habits. And here we have double advantage that the Anganwadi worker also tells those children that when you go to your home and take your meal, you also practice the same. And ask your family members also to do the same. So through that, these children, I think these children are being sensitized at a very early age, and through these children also they are putting the family members into a pressure of doing hand washing. So I think these are very good examples, and there are certainly many other things that we'll hear on the course of this discussion.
Thank you so much, Dr. Dev. Yeah, interesting, aspects you have brought up. But yes, innovation is important. How we can bring behavioral change, not necessarily technology oriented. It can be just, some kind of small, behavioral incentives maybe, which can help. So that definitely an important aspect. We have with us Dr. Ranby Majumdar also. He's honorary chairman of International Academy of Environmental and Sanitation and Public Health. Dr. Majumdar, welcome. So we were discussing about, on this day of World Hand Hygiene Day, the important aspects which we are discussing today is that what are the health burden we are facing in lack of this important practice, which we have seen extremely, getting a very, very, phenomenal response from the people. The adoption has increased, manifold in the COVID-19 time. But I think we are again, over the period going to lose the track, because I can vouch that people are not sanitizing their hand as many times as they used to sanitize maybe a year back. And this is again, seeping into our habits. While we used to see everywhere sanitizers being kept, before you enter a place or a hotel, restaurant, or an office. Today you hardly find them functional. So I think that's how we kind of go back again on our behavior and undo a lot of gains which we get through certain behavioral changes. Dr. Majumdar, on a large scale, what is your opinion about adoption of sanitation and hygiene practices in our country? How sincere we are from the system point of view to make these practices be part of the day-to-day life of masses, and how do you see the people's participation in that?
Thank you. So good morning everyone. It's a pleasure to be here, and thank you, Mr. Narayan, for introducing me. Well, it's a very valid question. What is the relevance and how we can do it is definitely very relevant. But as you mentioned yourself, that some time back when the COVID was at its peak, or the pandemic time, or the lockdown period, people were very cautious about it, and they were more particular about it. And we have also seen long back when plague had wrought havoc in Surat. People were so, they were so scared that they took all the precautions. And that's why the Surat Municipal Corporation had a great success in streamlining the waste management of Surat city. So what is important here is the psyche. So when the fear factor is there in our mindset, then we work according to that. So therefore, apart from the government efforts, apart from the departmental efforts, apart from the efforts of NGOs and others, the private companies, all of them, I think one of the most important thing, the most crucial aspect is education. Education about the impacts of good hand hygiene. It has come again and again, wherever there have been a pandemic. Well, I had, I can tell you an anecdote. I had worked in Argentina, Bolivia, and Paraguay. They had cholera, in 1992, and 4 persons from here were sent there. So our task was, mine was as a public health person, to look after the possibilities of sanitation. There, in the universities also, we had discussions everywhere. We had to traverse through the villages, hospitals, and everywhere. But in the universities particularly, and in the government departments, they asked us very pointedly, why is it that in India and in that belt of India, Bangladesh, cholera is endemic? In those days, it was about 3,000 casualties in a year. So, but we have invited you, but why is it in your country it's not happening? They had only 15 deaths in Argentina. And President Menem had, contacted the Rotary International, and finally we were sent, 4 of us. So that is the kind of sincerity. So I'll come back to other points, but to wrap up what you just mentioned, one thing is the psyche. So we need to explain to people the real implication. See, in waste management also, I usually keep this point, whether in my writing or in my presentation, that in the IEC also, that is information, education, communication also, we must give practical examples. Like in pandemic, during the pandemic, when, if we take Delhi, for example, when the hospital beds were not available, everybody was running helter-skelter. So there was this fear psyche, same was in Surat. So if we know the implication, so if we say that because of lack of hand hygiene in this colony, 100 people were down with gastrointestinal disease. So then I can relate it. The people in the slum, the people in the school, the people in the offices, in the corporate sector, they can relate that yes, it is something real. So in our IEC also, we should have those data, realistic data as to what is happening around us. So I'll speak again, but these are the 2 points that I would like.
Thank you so much. Yeah, thank you so much, Dr. Majumdar. Any important points and very interesting suggestion also. And I fully agree that when you are giving a real life kind of examples, people have the more inclination to accept that. We'll come for more on that. Dr. Ramaranjan, let me come back to you, and we other speakers also have in a way touched upon that point also, that there is definitely a certain behavioral practice differences in urban and rural areas as well. And you were mentioning in your initial statement that you have the field practices in urban and rural area. What unique differences you have kind of noticed, and what are the challenges we are facing in terms of ensuring the similar kind of or the desired level of hand hygiene or the other sanitation practices in our rural folks?
We have observed that though there is a lot of scope to improve, but things have improved. Things are improving, and things are definitely improving. Because, for example, in rural areas where we work, I mean, no person drinks water from the pond. They drink water from the tube well. So awareness is increasing. Awareness has increased, and that is why the incidence of diarrheal disease is also decreasing, at least in this area, this part of the country. But things are not the same everywhere. For example, like I met some people who work in tribal area in Jharkhand. So once they were sharing their experiences, they went and distributed soaps to people, including children. So when the children got the soaps, they were very happy. They started eating the soaps, because they have never seen soaps in their lives. Forget about using it. Because soaps are very attractive, they're colorful and beautiful.
Fragrance.
Yes. So they thought that these are sweets. So they started eating it. So our friends had to tell them, it's not for eating. Then they explained them how to use this and how to use water and soap and wash the hands. But things are not like this in this part, because we have seen in the urban areas, urban slum areas, there also awareness is there, but maybe practice is not there. The habit is not formed, because if we tell these children in the school, it's fine, it helps, but it doesn't help 100%, because it's said that children do not listen to you, they observe you. They observe their parents. They see what their parents are doing. So we give health education in the schools that helps to some extent, but not 100%. And even in the rural areas, we have seen that people are aware. And what we do every year, we used to install one tube well in that particular village. So now almost all the villages in our area, they have tube wells, and people are aware. That's why if you compare our area with the other areas of the state or the country, the disease rate is much lower. Diarrheal disease rate is much lower. And people, when we teach them the steps of hand washing, so first they were not very interested. They said, we are wasting time, and so much time is wasted. It's not that, it takes very little time. But then any habit, whenever they develop a new habit, there is some obstacle, there is some hesitation. But then slowly and steadily, habits are changing, and people are also changing, and they are changing for the better.
Thank you, Dr. Pati. So I think very important point here is that when the infrastructure is getting strengthened, as you are mentioning that since tube wells are getting installed in most of the village, the possibilities of them having access to the the better quality of water and is there, and that's where they can follow certain practice. But what we see, and that's for that I'm coming to Dr. Alok Dev also. Dr. Dev, when we see urban and rural, the behavioral things, you can see a lot of commonalities also. For example, it is difficult to even tell, if I bring my own, example to tell my own children, and all the time that, whether they are washing hand properly before they are eating anything or sitting for a meal, because, their hands are going to in their mouth, maybe 100 times in a day, or maybe more than that. And certainly they do see their parents and the others following certain hand hygiene practices, but maybe sometimes people are too lazy, or children don't kind of understand that. Yes, when they hear something in school, they definitely come back and they say that, okay, we should do this, we should not do this because my teacher told this thing today to me. How do you see that, bringing this behavioral practices? And I think, it is equal for both urban and rural area. What can be the unique, or what can be, the important intervention which can happen through the school level, through maybe, panchayat level, to maybe, a municipality level, to kind of, preventive health, on which hand hygiene can definitely be one of the most important practice, becoming part of all these areas.
Thank you. Yes, definitely a very important issue. We regularly actually do various IC activities among various groups, including school children, even school teachers, and many other groups, especially in urban slums. But I would like to give an example of another group. And through that example, I would like to highlight some of the issues that are related to these IC activities, how they can be made successful. There are many, small roadside eateries catering to people from poorer sections, like the rickshaw pullers, the porters, and all. And hardly they maintain any good food hygiene or the hand hygiene, not only for the food handlers, but also for the customers. And many times you'll hardly see enough water having inside those eateries. Right? So we have a lot of such eateries around our campus in different streets. So as part of our campaign, we started it around 2 years back. Okay, so what we did is that we went to those eateries, and at a time when not only the owner or food handler was there, but also the customers are there, so that the both sides are present. So in presence of them, we demonstrated how to wash hands properly with water and soap. We told them, as Dr. Mojumdar already highlighted, what are the diseases that can be transmitted when the food handling or hand washing are not properly done. And we did it in a repeated fashion, usually once a month. This repeated hammering, and mind that although there are some floating customers, but usually these eateries has a constant pool of customers. So when they're getting repeatedly hammered, what we observed after say 6 months or 8 months, because it takes time, that many of these eateries, they then had one drum of water with a tap in it and a soap beside that. That means the customers are demanding that we should have access to water and soap so that we can wash our hands before we eat, right? So I would suggest not only in this setting, but in other settings also, it needs repeated messaging and better with practical demonstration and with some examples. And not only that, also a kind of monitoring, a regular monitoring of the situation, that whether it is improving or not. If not improving, then what went wrong, whether we need to modify even the IEC materials or the way we are giving the message, because not all the groups will accept the same kind of message. So they have to be tailored also. So these are our experience working with the different groups. So yes, their behaviors can be changed. It takes time. We have to have patience, but with some, again, I would say this is some innovative way to deliver messages, innovative way to demonstrate them, and repeatedly doing it. Thank you.
Yes, thank you, Dr. Dev. No, important points you have highlighted, and definitely, when you are repeatedly, kind of hammering that particular messaging, it do impact, and the people start, realizing. But one important aspect also you are mentioning about monitoring. So you bring an innovative approach, you try to bring a behavior change, but how, there is also need of compliance monitoring also. So, Dr. Mazumdar, from the system point of view or from the regulatory point of view, maybe since Dr. Dev mentioned about eateries and roadside eateries and all that, I don't know, and I would like to understand from you, how many times, and in a city like Delhi or maybe Calcutta or maybe, Bangalore or Mumbai, how many times before a eatery is given a license to operate, for example? Is that a compulsion that they have to have a hand hygiene practice or, system infrastructure placed at their restaurant? And how much space is need to be given? How much soap it must contain all the time? For example, like there may be a regulatory requirement of a fire compliance or regulatory example of something else. Do we have this kind of policies involved, or can they be some kind of important nudges for making people understand that how important these practices are all in maintaining the public safety or health?
Yeah, these are also very relevant. And before I proceed, I must say that what Dr. Dev said, it's very important that things are hammered into our mindset, so that we don't forget it. It becomes our habit. This becomes within our reflex that we do that without even thinking about it. Now, coming to your issue about the regulatory support of these things. Well, the municipalities everywhere, whether it's a corporation or a small municipality or a municipal board, as per the regulatory aspects or the municipal rules, any eatery, any hotel, any restaurant they have to take permission. And the health department of the concerned local body, they have to keep a watch on their hygiene practices. But yes, so far, unfortunately, the hand hygiene practice of the customers is not included there. I think it's a very important point. And well, personally also, whenever I get a chance to do on these things, I'll definitely keep this in mind. I'll take a note of this. The practice should also include the behavior of the clients. Say, I was also one of the committee members of a NGT committee for some time till the pandemic came and everything was locked down and so on. So we saw that with a lot of enthusiasm, they swooped upon the thelawalas, all these small eateries on the streets, and everything was done. But this particular aspect of hand hygiene, it was not there. So definitely, you are very right. I think we must have this within the precincts of the regulatory norms. I think Dr. Pati also, since you are working with the government as well, the suggestions from the All India Institute of Hygiene and Public Health would be taken very seriously by the government. So I think you should also, take note of this.
Yes.
In fact, Dr. Pati, I used to be one of your regular guest speakers back in the 90s. So I used to speak on sanitation, biogas technology, and all that. So later on, of course, because of
I joined in 2000.
Yeah. Okay. So this was in 90s. Okay.
Thank you so much, Dr. Majumdar, for kind of endorsing. Yeah, and I believe that the same can be applied in many things. For example, in one of the region I mentioned that is you might have seen even if in some of the finest eateries also the hand washing corner will be something completely hidden at one side, and with many times not even the hygiene of that area maintained. So I think those are the important nudges, because many times people don't feel like, I believe that the hand washing counter or a corner should be at the center stage of all the eateries. People must know this is the most important practice they have to follow before they eat. Maybe that can bring that kind of behavioral nudge for people to kind of follow. Dr. Pati, so we discuss about multiple aspects to it, and one aspect I think when you look at something on from the economical value point of view. So if you are able to convey people that how much you can save as money or earning, or maybe I think the same goes for even the nation. I think the economic burden is definitely quite substantial of all these health issues, and also in the behaviors which they lead to. Now, do you also have some kind of estimation that if we can nudge the governments, or maybe the local regulatory kind of administrations, or even the people, even the families, that if you are spending, let's say, 100 rupees per month in soap, you may be getting a return of maybe 1500 rupees in productivity, because that lack of 100 rupees investment on your monthly budget may turn out to be a important cost of health care, which is normally is for out of the pocket for most of the people in our country. So Dr. Pati, any suggestion on that?
Yes, it is very true. Actually, it is true for the family, and it is also true for the country. Because for a family, spending money on soap, it's not a big investment. One has to spend very little for this. But then, by using these hand hygiene practices, they can reduce the incidence of diarrheal disease. The same thing is true for the country, because we find that most of the disease load in the community, most of the patients in the hospital, they are diarrheal patients. Diarrhea with dehydration. So if we can reduce the load of the diarrhea, then we can we can, more beds in our hospital should be free. So, it's such a big load on the healthcare system of the country, that so much money, so much beds, so much, so many doctors are involved in treating all these diarrheal diseases. Because in any community, as I said, diarrheal disease and respiratory disease, these are the two commonest diseases in the community. So, the policymakers, even the Prime Minister of our country, is giving so much importance on proper drinking water supply, because we know that this can reduce the disease load in the community, and more hospitals do not mean more good health. Actually, it is the people should not go to hospital. Hospitals, people only when there is some severe health problem, only when there are accidents. In that case, or some rare diseases, then only people should go to the hospital. People should not go to the hospital frequently for the treatment of diarrheal disease. If the situation is such that so many people are suffering from diarrhea and admitted in the hospital, then there is something wrong with our health education. We are not able to spread the message among the people. So that means that shows our failure. So people should practice these hand hygiene practices, and people should not suffer from diarrheal disease so commonly. Some people may suffer, but that should be very, very rare. In fact, what we have seen is in the Western countries, they control cholera not by any medicine. They control cholera just by hand hygiene practices. Because when it was found that cholera incidents decreased in the European countries, those days, there was not very effective medicines against cholera. But just by improving the sanitation, by improving the water supply, they could reduce the load of cholera in the community. So we can do it in our country. And in our country is in such a situation that in the Western countries, what we find that they don't have this diarrheal problem. Maybe 2 or 3 people may suffer from diarrhea, but that is very rare. They mostly suffer from the non-communicable diseases, high blood pressure, cancers, and diabetes. But in our country, we are seeing that non-communicable diseases are increasing. Cases of hypertension, cases of diabetes, cases of cancer are increasing. But
they have double burden.
But cases of diarrhea is also still very high. So we are suffering from this double health problem. Communicable diseases are also high, and non-communicable diseases are also increasing. So if we can decrease the load of the communicable diseases, which the Western countries have done, so we can reduce the load on the family, we can reduce the load on the hospitals, and then we can reduce the load on the our country's budget. We can reduce our health budget. If we can reduce the number of the diarrheal patients in the community.
Yeah, very important aspect, Dr. Pati. Dr. Dev, reducing diarrhea itself can help us, not only save a lot of lives, or a lot of health burden, and kind of life cycle diseases also. For example, as I said that and referring to multiple studies only, and the information available that if diarrhea we are able to treat, but the repeated occurrence is also leading to severe undernutrition among the children, and especially the young children, and which has also become an important cause in terms of when we see the under 5 deaths in our country, which is quite painful in a manner, and puts a nation of our stature to in equal a parallel to many of those sub-Saharan countries. If we want to achieve the vision of zero diarrhea in our country, what are the steps needed, Dr. Dev? And is it possible to achieve that? Can we have a net zero diarrhea in our country?
Okay. Can I add a few things to your earlier questions before I go to?
Sure. Please.
Okay. So your earlier question was about what happens if we just try to tell the families regarding the economic issues of diarrhea or hand hygiene related things. Like if we spend 100 rupees on hand hygiene, then you can save this much from the diseases something like that. So this is a very good way. But sometimes what we have seen that the families fail to understand because they cannot visualize those things, that what will happen, I mean, how much I will save if something happens, some disease occurs. No, sometimes they have this disconnect. So we sometimes took some other approach that they can directly probably see. So, and it is like in terms of school or workplace absenteeism, right? So if you see, we tell them, you see that last year your child was absent from your school for these many days, and you were absent from your workplace for these many days, either because of your own disease or because you had to take your child to a doctor or a hospital. Right, and you lost your wages, your child lost his or her education and all these things. But after you started your in your community, or you started some hand hygienic practices, you see the losses have been reduced. So they can directly visualize. So yes, we can tell them in terms of monetary terms, but also we can take other approaches as well. Okay. For your current question, yes, there are few things that we have to do if we have to.
Sir, since you mentioned, just one point coming to my mind, and I would like to hear, from all of you on that. From a family point of view, it may be difficult to, visualize that how much they could save or they can save by spending this much, because the incidences of health issues may not be that frequent, but whenever they are causing harm both physically and economically. What about, making it as a national investment? For that matter, we are, providing people with rice and with wheat under our public distribution system, and we are ensuring that no one goes hungry. And this is important aspect to ensure that a minimum nutrition is reaching to the people and nobody die of hunger in our country. What if we start giving them, as a nation or as a government, under the public distribution system, start giving certain hand hygiene tools to the people, which kind of become adequate for a family depending on the number of people they have. So this become a national investment. But I think from a country point of view, we can definitely have those data which can prove the investment right. You can go ahead with your other answer. I'm just, one of the remark came to my mind.
My short comment would be like for other things like rice and dal and all these things. I mean, they have that necessity every day. They feel the hunger. They have to take it, right? But here, the question of behavior, the question of habit is also involved. You can take the example of constructing latrines. No, many latrines were left unused because they did not change the behavior. So, and we have also seen that even if, and you mentioned at the beginning that even if there are wash basins in many households, they don't wash hands properly. So here, not only giving them the necessary supplies, but also changing their behaviors, changing their minds, that is important.
Yeah, very much right. Dr. Mazumdar, so Dr. Alok Dev has also highlighted another important aspect, and when it comes to overall environmental sanitation and hygiene, and especially related to public health. And you also mentioned, and Dr. Pati also mentioned, that the Prime Minister has been very, very, kind of particular about I think increasing the hygiene standard of our country, and which began from, the call for toilet at every home, converted into a mass scale, ongoing massive campaign or public movement of Swachh Bharat, and then also, kind of building blocks of, the Har Ghar Jal and all those important aspects, because without which you can't expect a right kind of sanitation, being followed. What do you see, amid all these major interventions, how you are looking at the way forward? Is it going to change dramatically in terms of our the behavior of our public, and which can help us achieving the objectives like net zero diarrhea in India? Sir, you are on mute.
Yeah. Well, you see, if I say it in one word, it's WASH. WASH. Water, sanitation, and hygiene. And of course, the UN bodies had been after WASH or WASH campaign for almost 3 decades. But that impact was not there. In India, particularly, since the Swachh Bharat mission has taken place, this has accelerated significantly. And I do believe that, you see, actually hand hygiene or hand washing, it's a part of WASH. If you don't have clean water, if you don't have access to safe and clean water, whether it is for drinking or going to toilet or for for washing hands or taking bath. So access to clean water is one of the most important issues. Next is sanitation, which was just mentioned by Dr. Pati and Dr. Dev also. Sorry. So sanitation, again, it's a very closely interlinked, water, sanitation, and hygiene. So we know that if these three are there, then what you require is to fulfill what Dr. Dev mentioned, nutrition. So then the whole, that whole health cycle gets completed, and then people become healthy and they have that feeling of well-being. So therefore, we have to look at WASH as the overall umbrella under which hand hygiene should be focused, so that both things can come together.
Thank you so much, Dr. Majumdar. So I'll just quickly, I'll ask all three of you, maybe, three important takeaways from this discussion, which you feel are going to be important if we want to reduce the disease burden related to, all these infectious diseases being caused because of the, the poor hand hygiene or maybe the lack of wash, as Dr. and Majumdar mentioned. Let me begin with Dr. Pati, and after that I will be concluding. Dr. Pati.
Three important this thing. One is the people. I mean, we have to take this awareness to the people. We have to take the. Otherwise, what is the point of having the knowledge in the laboratory, or what is the knowledge in the book, unless the people? After all, this knowledge is for the people. People have to develop this habit. So we have to increase the awareness in the community, and investment. I mean, it's a It has to be a multi-sectoral approach. The government has to do its part. The health department has to do its part. The water supply department has to do. The public works department, they have to do their part. Then only, I mean, it will improve. Otherwise, only the healthcare people cannot improve the situation. And third thing, I would say that changing habit is not easy, because changing habit is not easy. But by repeated counseling, by different modes of communication, I mean, these habits will change. And in fact, habits are changing. Slowly but steadily, habits are changing.
Wonderful. Thank you so much, Dr. Pati. Dr. Dev.
Okay. Thank you. To my mind, the most important point or most important issue around this discussion, I would like to say, is that having socially and culturally acceptable repeated IEC with the component of monitoring is a very important issue. And these IECs or awareness generation, if done at a very young age, at a very early age, like in other sectors we call them catch them young, so it was better not only for them, but also for their family members, because they can induce their family members. Like it has happened in other areas. For example, for tobacco use control, people used little children, to induce their fathers or family members. So this is another thing. And lastly, there has to be some innovative ideas. And as I said earlier, that these ideas doesn't have to be very technologically demanding, because whenever we think of innovation, or we hear of innovation, first thing will come into mind is technology. But it may be even some simple innovation that can cause huge change. So
awareness, start early, and innovative practices is something which can help.
Right.
Us. Thank you so much, sir. Dr. Mazumdar. Sir, you are on mute. Yeah, please.
So I think we have come across a number of very important points. I'd like to just sum up as I see it. You see,
that will be great. You will save me from that. And we are anyways running out of time. So that
first point which you mentioned yourself, that we must close the loopholes in our regulatory systems, like arrangement for clients' hand hygiene, or rather, complete hygiene, etc., in eateries and restaurants and so on. So that I think is very important. Secondly, we have to look at the wider gamut of wash, because hand hygiene itself, only hand hygiene will not give the complete benefit, or that sustainability will not be there. So we have to look at the complete wash so that we get the maximum benefit. And thirdly, in the IEC, we must include the actual situation, the actual epidemiological records, so that we can relate that, yes, my friend, my known people, my known communities, they are suffering because of this. So I must be aware of this, and I must beware of all those points. So I think these 3 points are very crucial.
Thank you so much, Dr. Majumdar. I think we had a wonderful session, interesting ideas and insights coming from all of you. I think the crux of the whole thing is this action, and awareness. Awareness is, only useful when it is converting into action. Because just awareness may not help in terms of when we really want to, kind of bring a certain changes in the way, we face healthcare problems or health issues or public health issues in our country. So with this, I would like to, kind of conclude for today. The next session will be discussing more innovative approaches also, Dr. Deb, as you have mentioned, not maybe only technologically driven, but what can be the other social innovations and other cultural innovations, also communication innovations, which can help us bring this kind a desired impact or desired behavioral change in hand hygiene practices. So thank you so much for all of you for joining us today, and over to our next moderator, Riddhi Lakra, who is assistant editor with isw.tv. Riddhi, over to you. Thank you so much, sir, for joining.
Thank you so much.
Okay. Thank you.
Thank you, Kamal sir. As we were speaking about health hygiene, hand hygiene, and how important is hygiene for us, I welcome all of the speakers for the next panel discussion. We have, before I begin, I just wanted to check everybody. Miss Urvashi, are you here? Okay, I think Miss Urvashi has an issue with the video. She'll be connecting us back soon. Practicing hand hygiene is a simple yet an effective way to prevent infections. Cleaning hands can prevent the spread of a lot of germs, including those of the resistant and even the antibodies, and which makes us difficult, which is also becoming difficult and not even possible to treat. Like good hygiene decreases the chances of illness and also play an important part in ever increasing the life expectancy in terms of the various diseases. Good afternoon, everyone. I'm Ridhi Lakra, Assistant Editor, IHW.tv. While we talk about hand hygiene, awareness is the key, and understanding the seriousness of the subject, there's something innovation that helps in achieving the critical task. In this session, we would be discussing about the various innovative solutions, the awareness campaigns, and the communication, the very important part of the hand hygiene campaigns, and especially for the today at the Hand Hygiene Summit, about the positive impact that can be created for a better hand hygiene. Joining us for the today's session, we have Ms. Urvashi. Ms. Urvashi Prasad, she is the Director, Development Monitoring Evaluation Office at the Niti Aayog. We have Dr. Madhumita Dubey. Ms. Dubey is, Dr. Dubey is a former Director and Professor of Department of Health and Promotion Education, All India Institute of Hygiene and Public Health. We welcome you, ma'am. We have Ms. Meeta. Ms. Meeta is a senior wash specialist, and we have Mr. Nikunj Soni. Nikunj Soni is the assistant editor at Ahmedabad Mirror. I welcome you all. Hopefully, Ms. Urvashi, if you are there, if you can on your camera.
Yeah, I just have an issue with my video, but I'm here. Yeah.
Okay, so I welcome you all for the second Hand Hygiene Summit. Before we start, I just wanted to tell everybody can I start with somebody else, Ms. Irushi, by the time, maybe if you can switch on your camera?
I have a bandwidth issue actually, so I doubt I'll be.
Okay.
Yeah.
So as I wanted to start with you only, I'll just start. Ms. Urushi, we saw that in the pandemic, there was a change in the behavior of people, and a lot of people have also understood the part that it is essential to hand wash and clean their hands on the regular intervals. But while as now that we see the pandemic is about to end, and almost there are less number of cases, COVID cases, so people actually do not care about that part. So do you think people have actually forgotten the behavior change, and they have started living back in the same monotony earlier how they used to live?
Yeah. So see, I think the pandemic has provided, in a sense, an opportunity to emphasize some of these messages which have actually been always relevant. Hand washing is, as all of us would know here, is not something that is important or relevant only for COVID, but pretty much a range of infectious diseases that you actually get if you don't follow good personal hygiene, and it's much broader than just hand hygiene. But hand hygiene is critical in terms of whether it's the food you're consuming or the water you have, and whether your hands are clean or not. So I think this particular this is like a basic of public health. This is not something which we have only learned now. But what has certainly happened is that during the pandemic, we have had an opportunity to emphasize it in a very big way, along with certain other, public health behaviors, as well as personal, hygiene and health promoting behaviors. So I think we need to use the momentum that we've got during this pandemic, and we need to now build on it. And tell people that some of these habits which you've actually acquired over the last 2 years or so, you need to continue them, and you need to continue them because it doesn't just protect you from COVID, but it perhaps protects you from many other illnesses and many other types of infections. So I think it's a momentum that we certainly built. The message is not new. The message is something that anyone in public health would be saying for years and decades. but it's certainly an opportunity that we have, and we need to continue to build on it and capitalize on it, so that, as you said, people don't fall back into what feels like business as usual, in which a lot of these behaviors are actually neglected. So whether it's involving school children, whether it's involving youths, it's women's groups, it's, so many different channels that we need to use, both at a sort of mass communication level, but more importantly, localized communication, just given the sheer diversity in our country. And we need to keep getting these messages across that, just because COVID is going down, or, you're feeling more comfortable with COVID just becoming any other infection, it doesn't mean that you give up some of these habits, because there are still many, many other diseases which exist in this world. And, it's not that all of those have ceased to exist just because we've had COVID. So I think that's what we need to do, is to build on this window of opportunity that this very unfortunate, pandemic gave us. But try to continue to, drive home some of these messages in a way that people actually, engage with and understand and appreciate, so it has to be communication which is tuned to a manner in which people will be receptive. Yeah, thank you.
Thank you. Thank you, Ms. Urvashi. Ms. Meeta, I just wanted to come to you and ask, as Urvashi was telling about the behavior change, and we need to continue that practices, what we have learned. It was a good opportunity that during the pandemic, a lot of people have actually started washing their hands, even in the children. So I wanted to come in terms of the children. There were change in behavior in people. I mean, in the elders, it's very easy, whereas in the children, it takes time. So do you think hand hygiene, such kind of thing, is very essential to teach children? And do you think there are methods say a STEM learning and such innovative form of education system where the children can be involved and they can be taught at their lower grades only that hand hygiene is important? What do you say about that?
Thank you, Riddhi, for inviting. This is a very opportune time to discuss on hand hygiene, and I work with Japaigo Nishtha, and we are working in collaboration with USAID and Unilever to promote healthy hygiene behavior, of which hand washing, hand hygiene is is one of the key component of our all programs. So first I would say, if we see wash sector, education sector, health sector, hand washing with soap or hand hygiene, depending on the target audience, it's always there. It is, if you go through the all result framework or communication document of these department, it was always there. The thing is that COVID had put a re-emphasis on this, and we should definitely utilize it. Coming to children, I would say, there are very well researched program, and we are happy that, like our partners are quite expert in this. So they are very well researched program derived on result oriented hand hygiene program with children. And I would say, sometimes it's say when we were doing the watch program with the department and coming with the communication plan, we say that, and that was a time of school sanitation, then we say that, children are gateway to sanitation. So I feel it's very easy to convince them, as somebody said before in the earlier panel, catch them young. So I would say, we catch them young, and we have a very defined program framework, which is built in a well-researched sustainability metrics. It has a pillars which come with a very engaging, very entertaining tool for children, for their mothers, which can be done. And we are doing it in our field also. So, which can catch attention of a children to do hand washing in a proper way with a defined step for a defined time. And we have a set of tools in which mothers and children can engage. So our our learning says that if we have to work with children, we have to also work with the primary influencer group around it, which is mother, which is their teachers, which is the community, because any behavior change program require a continuous reinforcement. So once we aware children, once we engage with them, but working with the community influencer, with their mother, is also important to sustain their behavior. And I would say, talking about the STEM education, I would say, if you see the evolution of all education program, right from Sarv Shiksha Abhiyan, now the Samagra Shiksha, they all have a very, defined hand washing components. So we should definitely make use of it. And children, yes, I mean, they are gateway to sanitation, definitely.
Thank you, Ms. Meeta. You have mentioned a very important part that, like as you were discussing, the children are like we need to catch them young and start educating them in their very younger age. Dr. Madhumita, as we spoke about the people's behavior, both in terms of the, the younger children and in the children as well, yeah, people and the children. So, do you think that we need to come up with more sustainable behavioral changes for a longer term goal? Like we do practice like using of water, using of sanitizers. Now there are other ways, but do you think on a longer run these are sustainable, and we need to come up with, in terms of our population, we need to come up with more sustainable behavioral change in terms of hygiene?
Thank you for having me in this discussion, because this is a subject again which I've been dealing with for the past 3 decades of my career. And sustainability of behavior change is something which really needs looking into when we are planning these issues, because as we were talking about young people and adults, I do disagree that it is easier to change adults. It is more difficult to change adults. It is easier to change children. But it is good that we can build up certain inherent habits, and that happens at a younger age. So these are actually these captive settings, schools, hospitals, workplaces, all these act as captive settings where we can promote this hand hygiene practices, good hand hygiene practices, with the hope that they will be carried back into the society and snowballed thereafter. But again, what I keep on saying is COVID was a wonderful urgent opportunity which was actually promoted hand hygiene. But this was an elective process, isn't it? It's like when people had to select, well, I will wash because of this fear, because of this panic. And consequently, fear and panic is never sustained. So definitely this will go. So we have to think of ways for the system to buy it in. How can it be bought in within the system? So I have a couple of things to say here. One is that in a country where still there is no access to water, even in schools, Anganwadi centers, of a large percentage of the population, including children in schools, including children going to the ICDSs. So this seems a dream. So what I really want to say is there are other determinants which will facilitate this behavior change. And unless we address those determinants, be it physical, be it social, the norms which exist in the society, these cannot change. So we need to know what is preventing people. We have wonderful programs, as Meeta rightly said. We have nice programs, which can it be scaled up in such a situation? If not, then if we need to learn from it, we need to know what is there. So behavior change interventions have to be guided by formative assessments. And in a country like India, with a very diverse cultural contexts and different situations, there are hard-to-reach populations. There are people, including children, who cannot be put at par. So here, equality is a big issue, but more than that, equity. There are marginalized populations, there are deprived populations, so more focused attention needs to be given there. Along with that, I think there's a very big role that the media needs to play. It's a resource-constrained country, be what it may be, but still we are constrained in terms of resources. Safe water is a very valuable resource. So if it is a resource-constrained country, and when I walk down the streets or drive down the streets and I see that drinking water is flowing out of the taps, people are wasting it, people are washing indiscriminately in that, well, this sort of awareness, I mean, we assume that awareness is the magic key which will open up everything. It doesn't happen that way. So we need to focus on what are the bad practices, and media can play a very big. We know media is now guiding all our activities. So yes, as I said, the BCI, the behavior change interventions, have to be guided by formative assessments and has to be accepted by the policymakers for decision making. We actually need good data. There is very little data on access to soap, availability of soap in schools, elsewhere, because other wash indicators are regularly collected But this has only recently been introduced globally, and here I couldn't find actually data on this. So that is one. Second, a lot more involvement of media to make people aware of the wrong practices which are actually impacting on it. Thirdly, we need to focus our attention less on settings because they are a captive audience and we can build up their inherent habits. And finally, to ensure equity in this practice also and to make everybody enjoy the benefits, we need to focus more on the deprived, the marginalized, the more vulnerable groups, especially children.
Thank you, Dr. Madhumita, for that. And like you have mentioned, like about the data, that's a very important part. A lot of the brands also, like we keep also searching about the data. There is no much data about that. Whereas when you talk about the sanitary napkins and the usage of that, we have good data. But in terms of the hygiene products of the hand wash, we do not have much available data. I think we need to work on that. Nikunj, I want to come to you. You are a food critic. To understand a lot of diseases, if you see diarrhea, hepatitis, is being caused by the food. So, do you in your experience, if you could share your experience, like over the year, during the pandemic and before the pandemic, how has the food industry, food practices at the different food places have changed? If you could share something.
Hello everyone, good morning, and thank you Riddhi for inviting me for the panel discussion. I would like to speak in Hindi because I will communicate better in that, and some tough words I will speak in English. So जैसे मैं शुरुआत करूँगा मधुमिता जी से, जो उन्होंने बोला कि मार्जिनलाइज कम्युनिटी है उस पर ज़्यादा फोकस करना चाहिए, और दूसरा उन्होंने बोला कि मीडिया कैन प्ले एन इम्पोर्टेंट रोल। तो मैं दोनों बातों से सहमत हूँ, क्योंकि एक बात मैं आपको बताऊं कि कोई अर्बन एरिया में या कोई पोश एरिया में कुछ भी कोई पेंडेमिक आ जाता है, कि कोई भी कॉलेरा आउटब्रेक हो जाता है या हेपेटाइटिस का भी काफ़ी सारे केसेस आते हैं, तो इट बिकम्स हेडलाइन इन द मीडिया। बट व्हेन द सेम थिंग हैपन इन द रिमोट एरिया इन द विलेजेस, तो वो इतना ज़्यादा वो प्रोमिनेंस दिया नहीं जाता। तो दूसरा कि ये वहाँ के जो लोग हैं उसको जो रोग है वो हाथ से होता है, जो भी उनको हुआ है, डायरिया हुआ है, कॉलेरा हुआ है, हेपेटाइटिस हुआ है, जो हाथ नहीं धोने से, जो भी जम्स आने से जो भी डिसीजेज होते हैं, तो उसके बारे में उसको अवेयरनेस नहीं होती है। तो वी शुड प्ले एन इम्पोर्टेंट रोल टू अवेयर द लोकल folks, रूरल एरियाज। एंड नाउ कमिंग टू माय फोर्टे, आई एम द फूड क्रिटिक एंड फूड ब्लॉगर। सो अभी जो मीडिया की बात की मधुमिता जी ने, तो मैं उससे थोड़ा आगे जाऊंगा। अभी आप सुनते होंगे कि इन्फ्लुएंसर्स, वो इन्फ्लुएंसर वर्ड बहुत ही फेमस है। जैसे मीता जी ने बताया कि मदर इज द इन्फ्लुएंसर, तो मदर तो इन्फ्लुएंसर अपने फैमिली की और सोसाइटी की है, मगर उससे भी द सेम रोल इज बीइंग प्लेड बाय द सोशल मीडिया इन्फ्लुएंसर्स। they broadcast the food videos, short videos, reels on the Instagram, showing the food items. But I seen that in 90% of the cases, even 95% of the cases, कोई भी जो वेंडर होता है जो फूड बनाता है, उन्होंने कभी हैंड ग्लोव्स नहीं पहने होते। दैट इज द मेन थिंग। खास करके जो फूड आइटम से से फॉर एग्जांपल कट फ्रूट्स, जो आप फ्रूट कट करके उसको छूते हो तो इट इज प्रोन टू बी इन्फेक्टेड, वो स्पॉइल हो जाता है। दूसरा होता है कि आप जो भी फ्रूट के अलावा भी काफ़ी सारे फूड होते हैं, उसमें आपको सैंडविच बनाते हो, वड़ा पाव बनाते हो, जो अभी बहुत ही प्रोमिनेंट फ्रैंकीज बनाते हो, जो भी यंगस्टर्स में बहुत ही फेमस है, तो उसमें कहीं भी हैंड ग्लोव्स का यूज़ होता नहीं है। तो कमिंग टू द रेस्टोरेंट, ये जो मैंने बात की वो मैंने वेंडर्स और कार्ट और स्ट्रीट फूड की बात की। इवन रेस्टोरेंट्स के किचन में भी यही हाल है। दे नेवर अलाउ टू एंटर एनी गेस्ट इनसाइड द किचन। मगर किचन में भी वो भी जो भी सब्जी वो कट करते हैं या फ्रूट कट करते हैं या प्रिपरेशन करते हैं फूड की, सो दे आर नॉट वेयरिंग ग्लोव्स विच इज मैंडेटरी, एंड नाउ इट्स वेरी अवेलेबल इन द मार्केट इट वेरी लेसर प्राइस एज कम्पेयर टू अदर अर्लियर डेज। और दूसरी बात मैं बताऊं कि जब पेंडेमिक में लॉकडाउन के बाद जब ग्रेजुअली रिस्ट्रिक्शन कम हुए थे, तो रेस्टोरेंट्स और इटरी थे, उन्होंने काफ़ी सारे इनोवेटिव वे इंट्रोड्यूस किए थे। जैसे कि उन्होंने जो मेनू था, जो हाथ से टच करके उसको ऑर्डर देना है, तो वो मेनू उन्होंने डिसकंटिन्यू कर दिया था। वो लोग क्यूआर कोड से मेनू, मोबाइल के क्यूआर कोड से अपना मेनू बताते थे और उससे ही हमको ऑर्डर देना होता था। बट नाउ द सेम मेनू थिंग इज कम बैक। अब लोगों को बोलते हैं कि भी आप क्यूआर कोड से मेनू एक्सेस कर लो कोई भी रेस्टोरेंट का, तो लोग भी उसने अवेयर नहीं है कि नहीं नहीं लाओ भी मेरे को हाथ में दे दो, मैं देख के ऑर्डर कर लूँ, इट इज़ मोर कन्वीनियंट। क्योंकि मोबाइल की स्क्रीन भी छोटी होती है, वी कैन अंडरस्टैंड कि लोगों को इतना कन्वीनियंट नहीं होता, बट एट द सेम टाइम दे शुड थिंक ओवर द हाइजीन ऑफ देयर सेल्फ, उनका भी, और उसके बाद जो भी मेनू छुएगा उसका भी हाइजीन उनको देखना है। तो रिसेंटली वन बिग आउटलेट ऑफ फ्रेंचाइजी आउटलेट ऑफ आई कैन से क्रीम सेंटर, वो मुंबई और सभी जगह काफ़ी उसका बड़ा नाम है क्रीम सेंटर, उन्होंने डिस्पोजेबल मेन्यू है वो इंट्रोड्यूस किया है। यानी कि जो भी कस्टमर आएगा उसको एक अच्छा सा जो उसका जो डिस्पोजेबल मेन्यू है वही दिया जाएगा, उसके बाद में वो जब डिशेस के साथ वो डिस्पोज कर देंगे। तो ऐसा भी हो सकता है। दूसरी मैं बात में बोलूँ तो ये जो इंस्टाग्राम पर, फेसबुक पे और अपने यूट्यूब पे अभी काफ़ी सारे इन्फ्लुएंसर जिसके मिलियंस ऑफ फॉलोअर्स है, मिलियंस ऑफ व्यूज के आते हैं, तो वो मैं देखता रहता हूँ वीडियो, मैं खुद ब्लॉगिंग करता हूँ, तो वो मैंने देखा है कि कोई भी वेंडर या कार्ट वाला वो ग्लोव्स नहीं पहनता, तो कोई भी इन्फ्लुएंसर उनको एक लाइन भी बोलता नहीं है कि सर भैया आप थोड़ा हैंड ग्लोव्स पहन के आप जो भी फूड आइटम है वो बनाइए, फ्रेंकी बनाइए, पिज्ज़ा बनाइए, वड़ा पाव बनाइए, सब्जी बनाइए, आलू पराठा बनाइए, कोई भी बनाओ, तो आप हैंड ग्लोव्स पहनिए। कोई ऐसा बोलता नहीं है। तो आई कैन से कि जो सोशल मीडिया इन्फ्लुएंसर्स है, जो स्पेशली वो आर डीलिंग विद द फूड ब्लॉगिंग, वो और फूड क्रिटिक है, वो उसमें काफ़ी अच्छा रोल प्ले कर सकते हैं। और दूसरे मैं बताऊं कि अभी अभी बड़े रेस्टोरेंट्स या इटरीज में तो ऐसी अवेयरनेस आई है कि जो शेफ्स होते हैं और असिस्टेंट शेफ्स होते हैं, हेल्पर्स होते हैं, दे वेयर ग्लोव्स। मैंने तो कभी ऐसा देखा है कि वो मेडिकल ग्लोव्स पहन के करते हैं, विच इज़ नॉट गुड। अपना डेडिकेटेड एक अच्छा सा फूड आइटम के लिए ग्लोव्स आता है और वो सस्ता आता है, 5-10 रुपए का एक पेयर आता है, वो भी यूज कर सकते हैं। मगर जो सबसे ज्यादा फुटफॉल होता है, मैं मानता हूँ कि शाम के वक्त या रात के वक्त जो स्ट्रीट फूड के कार्ट्स होते हैं, रोड साइड के जो ठेले बोलते हैं वहाँ, तो वहाँ तो कोई भी, इवन कोई ऐसा अवेयरनेस ही नहीं है कि हम ग्लोव्स जैसी चीज क्या है, वो बोले ग्लोव्स जैसी चीज क्या है। अभी मैं अपना खुद का एक्सपीरियंस बताऊं, 2-3 दिन पहले मेरे को आई वेंट टू वन ईटरी, इट्स अ प्रॉपर फ्रेंचाइजी आउटलेट ऑफ बॉम्बे स्पेशल वड़ा पाव। यहाँ अहमदाबाद में क्या है कि वड़ा पाव बॉम्बे जैसा नहीं मिलता, वो उसको शैलो फ्राई करके देते हैं। तो देर आर मेनी पीपल हु वांट शैलो फ्राइड वड़ा पाव और वेराइटीज ऑफ वड़ा पाव। तो वैसे बॉम्बे जैसा नहीं है कि वो वड़ा उठा लिया और उसमें चटनी डाल दी और वड़ा डाल दिया और लेके चले गए। तो यहाँ प्रॉपर प्रोसेस होके वड़ा पाव बनाते हैं, उसको तवे पे शैलो फ्राई करते हैं, उस पे हाथ का काफी सारा यूज होता है, कम से कम 1 मिनट तक तो होता ही होगा। तो आई वेंट टू द आई मेरे को टोकन दिया और मैंने वो जो वड़ा पाव बनाने वाला जो था उस्ताद, उसको दिया। तो बोलिए सर ठहरिए मैं आपको देता हूँ। तो वो दूसरा तो उसका जो दूसरा हेल्पर था वो फ्राई करता था वड़ा, तो और जो आदमी जिन्हें बंदे से जिन्हें बात में कर रहा था उसको वड़ा प्रिपेयर करके देना था मेरे को। तो ही वॉज रबिंग हिज हैंड्स ओवर हिज पैंट जिप अगेन एंड अगेन। तो मैंने उनको बोला कि भैया आप मेरा वड़ा पाव बनाने वाले हो तो आप हाथ धोइए। तो वो बोला क्या हुआ, मैं क्यों हाथ धोऊं। तो मैं उसको क्या बताऊं, उसको मालूम ही नहीं था व्हाट ही वाज डूइंग। ही वाज कि ये तो सब नॉर्मली होता है। तो फिर मैंने क्या किया कि वो मैं काउंटर पर फिर से गया, उसको उसके ओनर को मैंने बताया कि भाई ये प्रॉब्लम है, मैं यहाँ नहीं खा पाऊंगा, और आप अपना जो जो भी आपके शेफ्स है, आपके जो उस्ताद है, वो लोगों को आप ऐसी हाइजीन की ट्रेनिंग दीजिए प्रॉपरली कि ऐसा मत करें। तो ऐसी ये सिर्फ मेरे खुद के साथ एक्सपीरियंस हुआ। तो ये तो मेरे ध्यान में गया, बाकी ध्यान में नहीं गया होता तो मैं भी वो खा चुका होता। तो ऐसा माहौल है। तो वी शुड फोकस ऑन सोशल मीडिया, और सोशल मीडिया के थ्रू इस पर अवेयरनेस आए तो उस पर ज़्यादा इफेक्टिव हो सकता है, क्योंकि लोगों को खाने हाथ और खाना दोनों इट्स वाइस वर्सा है, वो दोनों एक दूसरे के पर्याय है। तो उस पर अपने को खास फोकस करना चाहिए, और ऑफ कोर्स चिल्ड्रन को तो पहले से सिखाना ही चाहिए। दीदी।
Yes, thank you, Nikunj, for that. You have mentioned a very important point, that how social media influencers can play a very important role in creating awareness about such unhygienic practices at the places. Also, you also spoke about the innovations. Urvashi, I want to come to you. To understand how hand hygiene innovations can actually break the barrier of hand washing in the rural communities. When you see there are like various hand washing experiences, when you come and stand in front of the machine, there is an interactive screen which demonstrates and tell you that this is how you can practice. These can be installed at the schools. A lot of schools in India also have I've seen some projects where these hand installations are involved, and children actually enjoy hand washing, and actually enjoy the cleanliness part of that. And so how do you think that such innovations can actually break down the barriers of hand washing in the rural communities mainly? Urvashi.
Yeah, I mean, innovations, we have a lot of innovations which are happening. I think the challenge with innovations is sharing them across and really getting them, to be replicated, to be scaled up. That is often our challenge, because, we are such a large and diverse country that, often what is happening in one part of the country, or even in one district in a state, is often not known across. Also, there are innovations happening in different sectors, or there are different organizations which might be involved. So there are some innovations which might be civil society led. There are several innovations which might be community led. So I think, there's private sector, there's CSR. So what is really needed, and that is something that organizations like Niti Aayog, we have been trying to do over the last few years, and we need to do a lot more of that, is to actually bring together, so even in COVID, we came out with a compendium of, we didn't want to call them best practices, because, best practice is a very loaded word, and how do you really say what is a best practice or what is not? But essentially, we actually try to document various innovations that state governments, district governments, city governments, NGOs, private sector, citizens took in COVID, and these itself covered a whole gamut of innovations, and a lot of these also involved, hand hygiene and hand washing, and how that was promoted during the COVID times. In many cases, technology was used to either make the whole process more interactive or more engaging, or to just simplify things in many cases. So I think there are a lot of innovations happening. There isn't a dearth of innovations, but what we really need to do is to very systematically document these across the different sectors, across the different types of agencies, across different districts and states in India, because the Indian context is obviously very, very diverse. Yet there is a lot that we can learn, while what we do in a district in Kerala, it might not be exactly replicable, in a district in Chhattisgarh, but we can certainly learn across, we can certainly adapt, and customize. And I think that is very, very important, that, we systematically document, disseminate, especially at the district levels and below, the district magistrates and below. They need to really be aware of, what is happening, how it can be implemented, how it can be scaled up, what are the kinds of resource requirements if you want to scale up, a particular innovation or a particular good practice. So I think that is what we, particularly have a challenge, is the actual dissemination, the scaling up, because scale is what we need, in various pockets in the country. A lot of good work is happening, and a lot of good organizations, are working and achieving a lot of impact on the ground. But scale is really what we need in our context. We cannot afford to just have those pockets of good work. We need to make sure that it reaches every part of the country, even if it is a hard to reach part, if it's a tribal area, it's in a left-wing extremism affected district, whatever it might be. It might be, a part of the Northeast, it might be a desert region. So that is, I think, where we falter, not just in this, but in many, many areas, frankly. And I think that is what we need to do is the practices that we already have, the innovations that we have. We need to document the evidence around those. We need to disseminate very, very widely. We need to have platforms where we can actually share across, learn from each other. In many cases now, for instance, we have started doing webinars, with various state governments. So we just pick up a particular area and we say that, okay, we're going to talk, we're going to invite some states to talk about, their own good practices. And we have all the other states, actually attending those forums. So what this helps to do is, rather than a top down, rather than the center sort of sitting here and saying, okay, we're going to tell you what to do, it's actually the states themselves and it's various stakeholders on the ground who have actually implemented these practices, who can then talk to each other and share their experiences. So I think that is what we need to do a lot more of. There's still a lot of silos that we operate in. Even within the government, there's a lot of silos. If you see, there's different departments looking at different things. We don't even have that sort of integration of health and nutrition and, drinking water, sanitation, right? Even that kind of integration doesn't really exist in practice and the way our system is structured. So I think breaking those silos, disseminating information widely, so that these innovations don't get limited to, just particular pockets or particular parts of the country. I think that is really something that we need to focus on. And of course, the government, I think, has a very, very big role there. But the government alone, can never achieve, something like this in a country like ours. So, whether it's the media, whether it's the civil society, whether it's the private sector, whether it's any of us, just citizens, any of us who can actually get these messages out on a consistent basis, and make sure that we disseminate them, far and wide across audiences, that will make a difference. So I think that's what we need to do as far as these innovations is concerned.
Thank you, Rishi. You have brought in a very interesting point that how important is it is time that we systematically start documenting such innovations and also replicating. Replicating is important, as in terms of our masses, we need to send across to entire India. And you spoke about the geographies, like if person sitting in a Northeast could use the same innovation as in the Kerala, maybe it can be changed according to them. Dr. Madhumita, I want to come and ask you, we have seen a lot of innovations during this time of pandemic, and if you could share, if you have also come across some of the interesting low-income household hand hygiene techniques, if you could share that with us.
Actually, Riddhi, I think I would firstly once again reiterate what I wanted to say in the beginning. Urvashi has wonderfully summarized that we need to advocate for good hand washing practices, both amongst the common masses, but we also need to change our policies, as I have rightly, I think I have pointed out before also, that there are special areas which need to be looked into, and it's a diverse country, so cultural context specific things have to be taken up. But for this advocacy to be realistic, we need data. Once again, I would reiterate on that when we go to work in small places, we gather the local data and we perhaps formulate messages, design it for them, go about doing it. But the main barrier which is there is regarding accessibility of water, clean water. And I think Nikunj also pointed this out, that this is a very important deterrent in case of food hygiene also. The street vendor obviously doesn't have access to clean water in large quantities, enough to wash his hands every time, his or her hands, every time before preparing food. So while people prioritize washing hands with soap and water after going to the toilet, but they still do not prioritize washing hands with soap and water before taking meals. That's a common practice here. So there are innovations, here also, and more so all over the world, where people have innovated to improve availability of soap. Availability of soap has been, there are so many reports where we have seen that when you increase the availability of soap, people's hand washing behaviors do change. So multinationals have come up with low-priced soap. Self-help groups have taken up soap manufacturing and distribution in the local communities. But again, to make it happen, we need these data. And data also, there's been a lot of innovation worldwide of gathering this data of, again, availability of soap and availability of water for hand washing. If a woman has to carry water from a long distance, why a woman, even people who have to carry it to their street side stalls, then obviously the quantity is restrained. So naturally, we cannot expect them to be doing the optimum practices always. So that's where I think this though in the previous session, a lot was being said that technology is not the answer, but I think technology can play a very big role here of ways in which we can really gather real-time data from the field as what is happening, So we need to gather that, not in a small scale always, but we need to incorporate it into our data collection mechanisms which we have with the different sectors. The nutrition has some workers who do it, health has some workers who do it, the public health engineering has some workers who do it. So why not, as Urvashi said, break down those silos, bring it into line, and gather these data on a regular basis so that we can really optimally distribute the resources properly and where people need it. And we keep on saying about awareness. I think this is another thing which I feel definitely awareness should be done based on what is happening in that area. Because otherwise people lose interest, unless you really can tailor the messages somewhat to what they are doing. It makes it more interesting, promotes their motivation a bit. So that's another thing which we found. If you do it according to their real-time data of what they're doing, it becomes easier. Because even in an urban area, if you talk to the slum people in the same language as you speak in a housing complex, it will not really work because they are totally different situations. And Urvashi has rightly pointed out that it's a very diverse context. So the policy has to have roadmaps. The policy has to have specific targets. And I do look forward to states in developing these in due time so that it can be part of a regular process, not a one-on whenever a crisis arises. So we start jumping into it and start thinking about it. It should be a regular, ongoing mechanisms which really takes care of not only COVID. There are a host of infections and the well-being of populations which are at stake. So you really can think of innovations, further innovations, not only in terms of delivering messages, but also gathering data and using it for advocating policy changes. I think that's where we need to go.
Yes, Dr. Madhumita, you have rightly said how important you have again mentioned the point out of the data, like how important is gathering of the data in terms of the uses of the hygiene products and everything. And also as Dr. Earlier, you have also mentioned about the commenting on the Ms. Urvashi saying that we need to come up with more innovations, but also replicating those products. Meeta, I want to come and ask to you, the entire perspective of hand hygiene has changed with the innovation. We do agree with that part. We have a lot of campaigns happening, but then there is something, there's a rural India. We as sitting in the cities, we understand that everything is being sorted. Yes, I wash my hands, I have clean, my children are clean. But then when you see at the rural India, there are people still who struggle to understand that small part. So where do you think that for them, in terms of them, how can we bring a smaller innovations or something more creative for them for hand hygiene?
Very, aptly put through, Riddhi. We say that we work, our intervention is also in a quite number of largely rural areas. And as a program developer, what we say, I mean, though I agree with the previous speaker that India, with such a diverse socio-economic, geographical terrain, there's no one fit solution. But, as a program developer and, trying to come up with really, things which goes there, we can also look innovation. In fact, we are looking innovation into portfolios. One is a product innovation and one could be a process innovations. Maybe synchronization and, of these two would be required to come up with something, to sustain the practices, either it is for the children or it is for the health frontline workers or it is for the mothers. So, for example, I would like to touch upon few product innovations. Product innovation, we can think of facilities, a ready to use facilities. And I was happy that, to share that few years back, we were all having, a wash sector team was discussing in one of the forum where we have, and there was a competition across India, that, to promote new young entrepreneurs who come up with the product solutions and organizations to come up with the process solutions. So, the product solution is something which make your behavior or practice of hand washing very convenient, like you have a different need to have a pipe water supply, though it is always convenient. But in a situation where you do not have a pipe water, running water supply, then what could be the innovative thing? Or a area like a marketplace or a hearth in a village or a schools or Anganwadi center, what could be the or even a household, what could be the product innovation? So there was a very good presentation. I was one of the jury member in that, where the new entrepreneurs share their products low cost, with technology oriented, which have a sustainability, which have a locally repressed systems. So they were good because one thing we felt that they are not a rocket science. They need to be all the technical knowledge need to be simplified so that it can be used and maintained by the community members. So there was a lot of product innovation in the field, and there's also a process innovation, because when we say I want to wash my hand, then I will wash my hand. Maybe I do not require a basin or a water. And here I would also like to cite an example of a very interior village of Bihar, where we were in a field visit, and we saw that that they have only hand pump and 300 to 400 students in a school. So, and there's a half an hour recess, and we all talk, wash your hand for 20 seconds. Is it possible? So that the process innovation, what I would say they did, they made a 3-row. One is having a bucket full of water, one row was having soap, and they were faster in the process. Thing is here, it is a process innovation because you have one single point source and one ejection point source, and a 400 student all taught in a different means that you have to wash. And so such process innovations also is helpful. And another process innovation, I would say, there's a soap banks, which are tried in schools, or children saying it is your birthday, come with a soap kind of thing. So interesting example of a process innovations and also product innovations. So I feel that there has to be need of a very balanced mix of a product and a process innovation to come up with a thing. And it's become our role, the networks like us, to come up with a live example tested in the field, which can be really could be a learning point.
Thank you, Meeta. That's a very innovative way of telling, like a process innovation, and how we can bring that in terms of the children. Like easily they can come in groups and they can learn such things. Nikunj, I want to come and ask to you. We Indians, a lot of us eat with hands. So in terms of the eating habits, there is a thing that when you eat with hands, we do not actually wash our hands, and it's very simple that when you walk into a store or we want to eat, we forget that we haven't washed our hands, but we actually tend to eat, and it's a human nature. So this is also causing it's a very big health issue, while we do not consider that one. So do you think the food industry should come up with more innovative ways for us, or maybe the technology should come up with more interesting ways of eating food, and even consciously tell us that if you're not washing your hands, you have some alternative. Like as I said, a lot of people, Indians, do not have a habit of using cutlery. So what do you say about that, Nikunj?
देखो, आप जो फूड हैबिट की बात करती हो कि जो हाथ से खाने का है, तो वो तो सदियों से चलता आ रहा है, तो अ, उसको चेंज करने में काफी टाइम जाएगा. इवन आई सॉ इन 5 स्टार होटल पीपल ईट डोसा विथ देयर हैंड, नॉट फ्रॉम फॉर्क एंड फॉर्क या स्पून से नहीं खाते हैं. मगर अब मेरा ख्याल ऐसा है कि अभी जो भी हमारी हैबिट है, जो भी हमारा कल्चर है, उसके परव्यू में रह के हम क्या इनोवेट कर सकते हैं. तो मैंने आपको बोला कि जब लोग रेस्टोरेंट में खाना खाने जाते हैं तो मेनू को टच करते हैं. अब जो लोग रिपीट ऑर्डर करते हैं, तो उसके जो स्पॉइल हैंड होते हैं उससे वो मेनू को टच करते हैं और ग्रेजुअली मेनू बहुत गंदा हो जाता है. तो पहले मैंने बोला कि एक डिस्पोजेबल मेनू का होना चाहिए. दूसरा, एक बड़ा प्रॉब्लम ऐसा है कि काफ़ी सारे रेस्टोरेंट और ईटरीज पे मैंने देखा है, और वहाँ ऐसा होता है कि वहाँ वॉश बेसिन होता है, वॉश एरिया होता है, मगर वो वहाँ कोई हैंड ड्राई का मशीन नहीं होता है. तो एक बात है हाथ धोना, और फिर हाथ आप किससे पोंछते हो, आपको हैंड ड्राई भी करने हैं. तो आपने एक बार अच्छे से सैनिटाइजर से या अच्छे से सोप से या अच्छे से लिक्विड से आपने हाथ धो लिए, मगर आपको आपका हैंड्स वेट है, तो आप कोई भी नेपकिन, जो भी गंदा नेपकिन है उससे भी हाथ धो, तो अगेन यू विल बी, आप वही पोजीशन पे आ जाए हो जैसे आपने हाथ धोया ही नहीं. तो आई सजेस्ट कि ऐसे कुछ इनोवेटिव वे होने चाहिए. जैसे मैंने देखा है कि काफी सारी जगह पर, नॉट ओनली रेस्टोरेंट, के वहाँ सैनिटाइजर के सैशेज आते हैं. वो सैशे जैसे होते हैं कि आप, जैसे वो केचप के आते हैं ऐसे, कि आप उसको तोड़ दो और उसमें एक अच्छी क्वांटिटी का उस पर सैनिटाइजर आता है, उससे आप हाथ हाथ आप अपना साफ कर दो. तो उसको आपको हाथ ड्राई करने की भी जरूरत नहीं पड़ती, और आपके हाथ, डिपेंडिंग अपॉन द क्वालिटी ऑफ दैट प्रोडक्ट, आपके हाथ में जर्म फ्री भी हो सकते हैं. दूसरी सबसे बड़ी बात यह है कि ये सब जगह इम्प्लीमेंट होना चाहिए. मैं अभी आता हूँ, ये तो बात हो गई मिडिल क्लास और उससे ऊपर की लोगों की बात हो गई, मगर उससे लोअर मिडिल क्लास और इसके नीचे वाले जो क्लास है उसकी मैं बात करूँ, तो काफी सारे लोग हैं. जैसे मैं आंगनवाड़ी की बात करता हूँ, तो आंगनवाड़ी में बच्चों को मिड डे मील परोसा जा रहा है, तो वहाँ वो हाथ धोने जाएंगे तो उसके पास तो कोई प्रोडक्ट भी नहीं होता. वो मिट्टी से पहले हाथ रब करते हैं और फिर हाथ धोते हैं, और फिर अपने कपड़ों से ही पोंछ देते हैं. तो आप कितनी भी अवेयरनेस करो, हाथ धोने की अवेयरनेस करते हो, मगर उसके बाद हाथ हाथ को ड्राई करना भी इतना ही इम्पोर्टेंट है. तो वो जो मैं अपने, जो आंगनवाड़ी है या ऐसी गवर्नमेंट स्कूल्स है जहाँ मिड डे मील स्कीम चलते हैं, और से फॉर एग्जांपल जो स्ट्रीट फूड के वेंडर्स है, इटली से छोटी छोटी जो ठेले लगते हैं, वहाँ तो पानी भी नहीं होता. वो आप जब से वो पैकेज ड्रिंकिंग वाटर का कॉन्सेप्ट आया है, 5 रुपीज और 10 रुपीज की बॉटल, तो दे 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 डोंट कीप वाटर टू सर्व द फॉर द कस्टमर्स. तो कस्टमर्स क्या करते हैं, वो ऐसे ही खाना खा लेते हैं. तो वहाँ और ऐसी आंगनवाड़ी जैसी जगह, सब जगह ऐसे जो हैंड सैनिटाइजर होते हैं, जो जिसका बोले ना, जो क्वालिटी अच्छा हो, जो जिससे जर्म फ्री ज्यादा होता है, जो इफेक्टिव हो, तो ऐसे कुछ प्रोडक्ट्स है, उसको यूज करना चाहिए. तो देखिए, अब जब तक अपने कंप्लीट अवेयरनेस नहीं आ जाती, वो कंप्लीट अवेयरनेस आने में सालों लगते हैं. ड्यूरिंग दिस टाइम वी शुड एक्सप्लोर सच थिंग्स के जिससे लोगों की जो हैबिट है, वही हैबिट के परव्यू में आके हम उसको कैसे अपनी हेल्थ एनहेंस कर सके, ऐसे रास्ते निकाले. तो वन ऑफ देम इज दैट कि आप ऐसे, जैसे वो केचप के सैसेज आते हैं, ऐसे सैनिटाइजर के भी काफी सैसेज आते हैं. अभी लोगों ने क्या किया है, सैनिटाइजर जो बोतल आती है वो तो खरीदना ही छोड़ दिया है, और कभी काफी होटलों में भी होता है कोई यूज भी नहीं करता. तो आप जब फूड सर्व करते हो, या कोई बिल देते हो, या कोई आप फिक्स थाली ऑफर करते हो, या फूड पार्सल देते हो, या मिड डे मील स्कीम में आप फूड देने जाते हो, तो बच्चों को साथ में ऐसे कोई ऐसे या ऐसा कोई प्रोडक्ट होना चाहिए जो अच्छा सा क्वालिटी वाला हो, जिससे हैंड हाइजीन अच्छा रहे, ऐसा भी कुछ देना चाहिए. और मैंने बोला कि हम यहाँ गुजरात में तो काफी सारे फूड ब्लॉगर हैं, वो जो न्यूज़पेपर के पेपर में जो फूड सर्व करते हैं, पार्सल करते हैं, उसके लिए उसके अगेंस्ट में अवेयरनेस फैला रहे हैं. क्योंकि वो जो इंक आती है, वो हैजार्डस होती है, हार्मफुल होती है, वो जो फूड के साथ आ जाए तो लोग बोलते हैं कि आप जो पेपर, प्रॉपर जो पेपर आता है विदाउट न्यूज़पेपर, इंक वाला नहीं, मगर जो प्रिंट किए बिना का जो न्यूज़ प्रिंट आती है, या ऐसा कोई अलग पेपर आता है, वो यूज कीजिए, या कोई डिस्पोजेबल ऐसा डिसीज यूज कीजिए जिसको जिसके लिए लोगों को हेल्थ के प्रॉब्लम्स ना हो। तो अपने फूड इन्फ्लुएंसर भी है, ब्लॉगर्स भी है, वो भी ये बात है हैंड वॉश का, वो भी जो जहाँ भी जाए वो उठा सकते हैं, कस्टमर से भी बात कर सकते हैं और वो वेंडर से भी बात करके उस पर अवेयरनेस ला सकते हैं। क्योंकि अभी सबसे ज़्यादा कन्वेंशनल मीडिया है, प्रिंट और इलेक्ट्रॉनिक मीडिया, उससे भी ज़्यादा मैं मानता हूँ कि लोग ये सोशल मीडिया पर ज़्यादा फोकस करते हैं। तो उन लोगों को जो अवेयरनेस हमारे जैसे लोग देंगे तो सोसाइटी के लिए बहुत अच्छा होगा और जो हेल्थ इश्यूज है वो काफ़ी रिड्यूस हो पाएंगे।
Thank you, Nikunj. You have also brought on a very important innovation that like how there is a term like we have introduced small sachet sanitizers, and yes, a lot of other innovative ways can be introduced in terms of the food consumption, because that is also a very important part. Urvashi, I want to come and ask you, do you think, we didn't talk about the awareness campaigns. So, do you think the awareness about hand hygiene is more about creating a fear amongst people and then a solution to that? And firstly, they're creating a fear that there is a problem that you are not clean, your hands are not clean, and then they give a solution to it. So, Urvashi, do you think we need to change that perspective of on this, and how can we work towards creating much better awareness campaigns?
Yeah, fear is something that it might last for actually a very short time. So that is like in a pandemic, you can sort of have this sort of fear that if you don't do this, then you might get COVID. But as we normally know that human behavior is such that after a while you get used to things, and that fear doesn't really sustain or remain, or it's usually not a very effective strategy over long periods of time. So and especially because in public health, a lot of what you're trying to do is actually preventive, and I think the way sort of human nature behavior is, we're until something's actually happened, we are usually not very fearful, and that is why so many things which are actually preventive in nature we don't end up doing, because we haven't actually seen that happen to us, and so we think okay, jab hoga dekha jayega, that is an attitude that we often take to health in many other ways also, right? So which is why actually public health and preventive interventions become very hard, because you're not trying to cure somebody necessarily of a disease they already have, but you're trying to tell them that you need to follow these XYZ behaviors so that you don't end up getting a disease. So I think that is always much harder, and therefore fear is not something that I think can be a sustainable strategy ever. I think it has to be a range of communications that resonate with people, and what resonates with people varies very, very widely. When I used to work for several years in urban slums, and we used to try and encourage people to construct individual toilets, the reasons why people would be convinced to construct individual toilets were widely varying. Not everyone you could convince by saying that, oh, if you don't have this toilet, you're going to get diarrhea or you're going to fall sick. Or for a lot of people, it was social prestige. For a lot of people, it was convenience that, yes, okay, the elderly women in my family won't have to go out, or my neighbor has a toilet, so I should also get one, etc., etc. So actually, people's motivations are widely varying, and it becomes very important to sort of not have your own sort of intellectual arrogance in this, which sometimes people like us who have studied the subject, and we sort of feel, well, we know what's good for you, and therefore you should do this. You need to leave that aside, and you need to really engage with people in a language that resonates with them. Ultimately, of course, you want to convince them to do what is inherently good for them, but the way you go about that has to be something which you do with a lot of humility and a lot of empathy. You have to first understand where that person is coming from before you actually try to communicate a message to them. So I think that is very important. And usually I find that co-created solutions usually work the best, rather than just going in from, somebody going in from the outside and saying, okay, here, I'm going to tell you, you should do this. This is good for you. Some solution which you develop usually with the local community themselves, and something which has their buy-in. And when we talk of influencers also, there's influencers at multiple levels. There's a lot of influencers in local communities. These might be religious leaders. These might be panchayats. These might be different kinds of people who the local people actually, hold in high regard and listen to. It might be the, school principal or the teacher who's, well respected. So you need to go in with that empathy. You need to go in with that open mind to understand where those people are coming from. And try to co-create, a solution rather than, have any preconceived notions or, just try to speak a language which makes sense to you. It's much more important to speak a language which makes sense and resonates to the audience that you're actually speaking with. So I think that is really the most important. And by and large, it cannot be a language of fear. It has to have many other, elements which can be much more sustainable.
Thank you, Rishi, for that. And you there's interest what you said, how local influencers, they also can play a very important role. And yes, the fear is not the solution for creating awareness. Dr. Madhumita, I want to come and ask you, when we see 2 years back, there were a lot of campaign when the COVID pandemic started. A lot of campaigns started. Dettol also had brought a campaign about washing hands the right way, and then there were celebrity endorsements to that, in terms of using the product also. Do you think such similar strategies can actually develop a good behavior of hygiene in people? And do you think in future such campaigns can actually work very well in the rural India as well?
Well, as Urvashi said, I fully agree with her. These can trigger off certain things in the case of a crisis. But to sustain a behavior, it has to be bought by the community. The community has to own it. And that's why I kept on saying that when you are planning any behavior change intervention in a small or a larger scale, by sharing whatever you have learned, the lessons learned, one very important part is assessing what the society, what norms exist in that community, what are the beliefs, what do they value, what would motivate them for change. Because as she rightly spoke about the toilet, similarly, there are issues which people value. Whatever we are doing in terms of celebrity endorsements or whatever, we are trying to put across that appeal, the appeals which they value. So why not get to know from them and form messages accordingly and take action accordingly? And I would keep on harping that along with, awareness is a double-edged sword. Once people know, they would like to change, so they need to have the resources as well. So you have to have provision of resources in terms of water, in terms of soap. If you are focusing only on hand hygiene or hand washing also, and focus on the importance of washing before meals. And to do this, as communities are huge, and all of us know that it's a huge country with different contexts. So health promotion always says that you start it off in settings, make them healthy, like schools, like workplaces, etc. So that's more manageable, that's more doable. So let's start doing that. And again, as I said, everything happens and can be scaled up if there is the policy and program buys into it and forms a good, well-defined targets, indicators, roadmaps, etc. Breaking the silos, all of people coming together, coordinating and seeing how best we can gather data, track our progress, because SDGs also have built into this. We have a wonderful Swachh Bharat mission which has all these components built in, So it should be easy to have some more modifications or structural corrections in that if necessary, to capture all this so that we can make, once again, these messages based on what the community prioritizes, what the community values. Only then I think it can be made sustainable.
Thank you, Dr. Madhumita. Like you mentioned about the community. So, Meeta, I want to come and ask you. You have been working with a lot of groups around India. So do you think that like now that is there's social media, people who have access to mobile, they use social media, they get access to certain information. But when you compare that with traditional media like the Nukkar Natak and all, so how do you think that there is a gap and then we can bridge that gap with them? Like as she said, the community role is very important. The community influencers are like important, and they are creating an influence. So how do you think we can bring that change in terms of the rural India about awareness about the hand washing and hand hygiene?
Vidhi, I would say that, both is important, I mean, social media as well as the traditional media. And believe me, most of the development factor and government strategy is, is working on it. So you see, I mean, for example, I will take that definitely we are focusing on community, but nowadays community and the community front lines, they are, I would not say, I will not go into data analysis and say that how much percentage of smartphone we have in a rural area. But, if you see from past few decades that, access to social media for a community people, for a community frontline as something, has really come up. And I would say that, we have a digital communication as a very core strategy of our program, where we run a campaign. We have run, I think somewhere a few months back, we ran a campaign when there was a hit of a COVID third wave. We ran a digital campaign because that time, obviously, with the COVID, you cannot go for a large collections of gathering of people. So we run a campaign, and that campaign was definitely facilitated and supported by our field team, government field team, our community groups. So, and that was, I think, largely participated by the community people also, though it was a digital. So, one of the good thing of Corona is that the social media has reached down deeply. So I think, when we talk about a behavioral change, or the objective is to, that everybody wash hand, and they wash hand happily, not out of a fear, be it a child, be it a woman, be it a frontline worker, or be it any cadre of people. Then I said that, we feel that mix of both traditional and the social media is important, because, all have a different reach, all have a different effectivity to reach. And it is one of the important thing is that how you design this campaign. It should not be only one way. It should be more engaging. There are few reflections that's going on certain digital campaign, which was also designed for a community people. They were very engaging, where people were taking selfie, they are calling out. And if you see, the one example more, I would see, I mean, the First Bharat Mission, you see that Swachhta Sarveshan, they have, the polls come from our community, and, so this is a very important, be it a traditional campaign, be it a social media campaign. You should be having both in your bucket when you have to reach such a diverse population with, such a wide spectrum of population. And the core thing is that it should be very engaging. It should not be one way we are just going speaking. It should be, people should feel engaged. People should have an opportunity to interact and participate in those campaigns.
Thank you, Meeta. As we are running short of time, I would like to close the session with a very important part, that how change, like we can bring change in our communication, and a message of hand hygiene can be changed, and it can bring a positive impact. Like how we are bombarded with a lot of advertisements with terms of the soaps, or maybe the hand hygiene products on maybe social media. I would start with Nikunj. First, like how do you think that we can bring in change in our communication, and actually bring an entire and look forward to an impact, a better impact for in terms of hand hygiene? Your closing remarks on it.
हाँ, तो मैंने पहले से बोला कि जैसे कोरोना के पेंडेमिक के टाइम जो अवेयरनेस आई थी, जो मोमेंटम गेन हुआ था, तो वो कंटिन्यू रहना चाहिए। और ऑन द सेम पे मेरे को लगता है कि अभी 2 साल से तो ये कैंपेन चल रहा है, और थोड़ा अभी स्लो हुआ है, तो अभी वो दूसरे 2 साल तक चलाएंगे तो उस पर काफ़ी सारा उसमें चेंजेस आ सकता है। अभी मैंने एक न्यूज़ में पढ़ा है कि जो सैनिटाइजर कंपनीज है पर काफी सारा स्टॉक पड़ा रहा है, कोई उस पर बिक भी नहीं रहा। तो वो क्यों हो रहा है? क्योंकि अभी लोग फियरलेस हो गए। तो हमको फियर नहीं लाना, मगर एक अवेयरनेस लाना है। तो हैंड हाइजीन शुड बी द अटमोस्ट प्रायोरिटी। और दूसरा कि अपने जो भी फूड से रिलेटेड जो भी वेंडर्स है या रेस्टोरेंट ओनर्स है, होटल ओनर्स है, और दूसरे जो भी स्टेक होल्डर्स है, इन्फ्लुएंसर्स है, तो उसकी एक पीरियोडिकल मीटिंग होनी चाहिए कि आप कैसे हाथ के टच के बिना आप फूड डिलीवरी करें या फूड प्रिपेयर करें, या ऐसा कुछ भी इनोवेशन आए कि जिसमें हाथ का डायरेक्ट टच ना हो। आप ग्लोव्स पहने, वो तो एक बात है ही, उसके अलावा क्या क्या कर सकते हैं। तो यहाँ अहमदाबाद में ऐसी कुछ रेस्टोरेंट भी आई थी कि वहाँ पूरा रेस्टोरेंट में आपको कुछ टच ही नहीं करना है, सीधा आपके पास फूड ही आएगा। मेनू भी है, उसको भी आपको टच नहीं करना, वो भी डिजिटल है। ऑर्डर करना है, वो भी आपको डिजिटली ही ऑर्डर करना है, वो आपको वेटर आपके पास ऑर्डर लेना भी नहीं आएगा। तो ऐसे कुछ इनोवेशन करने चाहिए। और अवेयरनेस तो अपने हाथ धोना, ये तो हमको बचपन से सिखाया जा रहा है, मगर हाथ कैसे धोना, कब धोना, और उसके बाद क्या क्या प्रिकॉशन लेना, वो भी एक जरूरी बात है। और मैंने आपको बताया, मैं अगेन रिट्रेट करता हूँ कि जो हमारा जो अनप्रिंटेड पेपर में जो फूड सर्व करने का, या फिर डिस्पोजेबल्स जो है, जो हम रीयूज कर इन्वायरमेंट फ्रेंडली डिस्पोजेबल्स है, उसमें हम फूड सर्व करने का हमने कैंपेन किया है यहाँ के काफी ब्लॉगरों ने। ऐसे हम ग्लोव्स पहन के जो शेफ्स है वो कुक करे, और वो भी ग्लोव्स भी एक 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 ग्लोव से नहीं जो पूरा दिन चला दिया। वो आपको 2-3 फूड आइटम्स बनाने के बाद या 1-2 घंटे के बाद चेंज करना रहता है। तो ऐसी एक हैबिट इनकलकेट करने के लिए भी एक कैंपेन चलाना चाहिए, ऐसा मेरा मानना है।
Thank you, Nikunj. Dr. Madhumita, your closing remarks.
Okay, so I think in line with what everybody has said, I think there are things which we need to take care of. One is, yes, as you have said, we have long been harping on washing hands, particularly in terms of COVID pandemic. But as we also know that behavioral fatigue happens, precaution fatigue, we call it. So people are tired after a period of time, and they don't give much importance to that. So there are ways and means available. People do know, the specialists know, the scientists know how to message to overcome this fatigue. Too much of disseminating messages is not okay. So just let's redesign the messages so that it becomes appropriate for the time. So redesigning of messages is essential now, because what worked in the beginning will not work now. Now it's a different priority, so we'll have to redesign the messages. Secondly, there should be enough cues or reminders everywhere so that people keep being reminded about it. And thirdly, I think the facilities should be there. If you have facilities, if you have water, if you have soap, and if you have the cues or reminders to tell you what to do, then obviously, even if you don't want, somewhere in your mind it will play, and you would be motivated to wash hands. So that's my take on it.
Thank you, Dr. Madhumita. Ms. Urvashi.
Yeah, I think there's multiple aspects of this. There's obviously the as we normally call it, the hardware aspect, but that's basically provisions, as we've been talking about, that if you're telling people to wash hands with soap and water, obviously you need to firstly ensure basic availability of that across the different types of settings, whether it's at home, whether it's institutional settings, schools, etc. So I think that is definitely one side of the coin. But the other side, and that's always also perhaps the trickier side in many cases, is the behavioral part. Is not just about bringing about the change, but actually sustaining it, making it a part of people's daily lifestyles, so that you don't always have to have someone from outside coming in and telling them what to do. So I think those are both elements that we obviously need to work on. And that, as I said, from the start, it needs these different stakeholders to come together. It needs us to try and break as many silos as we can within and outside the government. It needs us to have a multi-sectoral approach. This is as much of education's problem as it is health, or as it is gender, or water or sanitation. So I think inherently how we approach these issues, which is often very fragmented or siloed, that does need to be addressed, even though it is perhaps one of the biggest challenges for us to address, but we do need to find ways to do that. And we also need to find ways to disseminate information, disseminate good practices that we already have. I think we always talk of challenges, but as we know, there's so much good work already happening, and a lot of it is just about disseminating that, communicating that across stakeholders, and making sure that there is a chance to replicate that and to scale that up. So I think these are the elements, in summary, I would say that that we need to focus on going forward. Thank you.
Thank you, Rishi. Last, Meeta.
Key takeaways would be, could be that, they need to, when we talk about any communication-oriented program and with a diverse stakeholder to get it involved, I think the standardization of message need to be very clear. Sometimes we talk 40 seconds, sometimes we talk 20 seconds. So there has to be a standardization of message. Everybody's giving message same, especially on the basics. And then I would say, the approach should not be prescriptive. I mean, there's a willingness to adopt those practices. And therefore, at the stages of program design, we need to thought about a reinforcement stage, a reward stage. So those are important, and very especially, when we interact with the community. And there's also a certain study which this theory is based on, that, after a certain time, retention goes down. So that time-bound delivery of a message in an engaging way would be good to look at. So that is.
Thank you, Meeta. And I would like to thank all the panelists. I would like to thank Mr. Nikunj, Meeta, and Dr. Madhumita Dubey and Ms. Urvashi for joining us for this panel session. The next, as we start with the third and the final panel session, I would like to invite our other panels here. We have Ms. Dr. Neela Mohan. She's the Director, Department of Pediatric Gynecology, Hepatology and Liver Transplantation, Vedanta.
Gynecology.
Oh, yes, gastrology.
Gastroenterology.
Yes, I'm so sorry, ma'am. Yeah. And we would be talking about the very important aspect about how diarrhea is affecting almost 1.1 lakh children here in India. And as we discussed on the day of World Hand Hygiene Day, one of the important ways, like it is affecting, like the hand hygiene is also directly affecting a lot of children and the mothers, and how it is related. We'll be discussing in the next panel session. I would like to introduce the panel members here. We have Professor Ravi Kant. He's a former director, AIMS Rishikesh. Welcome you, sir. We have Dr. Govind Makaria. He's a professor, Department of Gastroenterology at the AIMS Delhi. We have Dr. Professor Anil Arora, Senior Consultant, Institute of Liver, Gastroenterology and Pancreatic Biliary Sciences, Sri Gangaram Hospitals, New Delhi. We welcome you, sir. We have last panel, Professor Dr. V.J. Mohan Prasad. He's gastroenterology, hepatology and therapeutic endoscopic founder, and he's also the founder and the chairman of VGM Gastro Center at Coimbatore. We welcome all the panelists, and over to you, ma'am. Dr. Neelam, thank you so much.
Riddhi, for that kind introduction. And it's indeed my pleasure. I was asked yesterday, but when I heard about the panelists, I said, wow, I will not miss this opportunity to meet all the stalwarts on one podium. I think it's a very interesting part and initiative that has been taken during this Hand Summit program. And the reason I say that it is very important is because unless we keep talking, like most of the time Anil Arora is pretty sarcastic, and he keeps saying that ye to government agenda hai, babu ki baatein hai. But I think it's not all about babu. It's all of us together who can make an impact. And I personally believe that knowledge or getting, a way to progress is getting out of ignorance about something. And educating people is a really, really best way forward. Sometimes we know things, but we take it for granted, some simple facts. So we will keep this discussion in a way that I will be discussing some clinical based facts and also discussing what the initiative have been taken and what you think should be better initiatives that we can take, because we did not achieve the mission that we wanted in 2019. So why did we not achieve, and what is the way forward? To start with, dear friend of mine, Mohan, and since he writes a lot of books, so let us hear from him what is actually the burden of diarrhea, whether it is adult children, what is the burden of diarrhea globally that we talk about? It is different in adults, children, and your take a message for that.
Yeah, thank you, Neelam ma'am. And thanks to the organizers for inviting me. See, the diarrhea is one of the major problems of the underprivileged countries. And, if you look at the global burden, which was published in Lancet Infectious Diseases 2018, they just analyzed 195 countries between the period of 1990 to 2016. And they said it's the 8th leading cause of death in all ages and the 5th leading cause of death in the under 5 age group. And rotavirus is the leading cause for death among all these conditions, all these diarrheal episodes. And if you look at the incidence across all age groups, it's 0.61 episodes per person per year globally. But if you take the advanced countries, the high income countries, it's only 0.13 across all ages, episodes per person per year. And if you take under 5, it's 0.58. That's it. Whereas, in India, if you come to the incidence, it's about 0.5 to 1%. One episode per child per year. It's 0.5 to 1 episode per child per year.
Up to 2% in the states.
Yeah. And here again, there is a vast difference between different states. But some of the states like Kerala are very, very low. Some of the states like Delhi and Uttar Pradesh and Madhya Pradesh are all quite high. It goes anywhere up to 2.88 episodes per child per year, which means these states have to really concentrate on this. And the prevalence also has been given in some studies. The urban West Bengal is one study which quotes at 31.67% prevalence in under 5, the diarrheal episodes.
So I think that was a very beautiful way of just giving an impact that what is the burden of diarrhea. And I would also take this and future questions is because this burden is that we're talking. One message I wanted to give is, though under 5, if you want to know if any country is developed or not, there are some standards you look at for health. And one of the major standards that are looked for is the mortality under 5. That is the way you address how developed a country is. And we talk of under 5, majority of the time it is 6 to 24 months that we are going wrong. And why are we going wrong between 6 to 24 months, we will address. Now, since he said this burden which he gave you, Govind, is so huge, he said practically 0.6 episodes per year per person or going up to 1 to 2. My other thing is that most of these people in India, they take antibiotics. So could that be a reason why there is antibiotic? What is your thoughts about when people get diarrhea? Do they go OTC antibiotics? What are your thoughts about, sitting in a government store? What do you think about antibiotics and the burden in diarrhea?
Absolutely right, Neelam.
I want to ask that to Govind.
Oh, sorry.
Govind, unmute.
Thank you, Dr. Neelam. And so this is a great question. And I'd like to dwell upon this question. And I'd like to reemphasize time and again that where to take antibiotic and where not to take antibiotic. The question is that in children and also in adults, the burden of diarrhea in adults is much less compared to children. Children sustain less to dehydration, therefore there's a high mortality. Adults sustain more to dehydration, therefore they sustain the effect of dehydration, and the death rate in adults is much less. But normal, as Dr. V.G. Mohan Prasad said, the diarrhea is very common. And to look at simple terms, in our country, in many regions, every child will have 2 to 3 episodes of diarrhea every year. 2 to 3 episodes of diarrhea. Even adults, I think all of us will have a 1 episode of diarrhea, I think once a year types. So these diarrhea are self-limiting. They last for 3 to 5 days. And 3 to 5 days diarrhea episode will go away, except for certain substances or circumstances where diarrhea may last longer and may be more serious. So somebody have diarrhea, the normal response, and this is what have been learned in our family and in society, that take antibiotic. There's no regulation in our country that you go to over the counter, buy antibiotics, take some drug, and then take drug and come home, and you get better in 2 days' time. You're better not because of antibiotic. You're better only because you're going to be better otherwise also. But most diarrhea, even in children and adults, are viral. Virus means there's an infection of the virus of the GI tract, leads to secretion of water and electrolytes in the GI tract, and that leads to diarrhea. These viruses are self-limiting, including rotavirus, and within 3 to 5 days, this virus will be eliminated by our own immune system, and therefore the virus is controlled, the secretions will get controlled, and diarrhea will respond spontaneously. So by giving antibiotic, we're not doing any good. One, there are certain circumstances, most are viral, but certain could be bacterial. Even bacterial, most don't require antibiotic. So when do we require antibiotic? If we have a diarrhea with fever, if a diarrhea with blood in the stool, in that case, you may require antibiotic, and you must see a doctor before you take antibiotic.
I think that's one key message which I've noted in the end, that no to antibiotics, because he said most of the time it is viral. Very few indications. Blood in stool is an indication where you need to take antibiotic. Fever could also be due to simple viral can also give rise to fever. So that's a message. Now we have a national family health survey every 5 years, and the last survey was in 1990-20. And what I want to impress onto you is to reduce the mortality related to diarrhea, as Govind highlighted. Basically, the deaths due to diarrhea is because of dehydration. So the wonder drug which can prevent dehydration was ORS. But the prescription rate of ORS is poor in our country. It was seen that people were prescribing antibiotics rather than writing on the prescription ORS. And therefore, the point prevalence which was seen in children, suppose you go and take a survey in the last 2 weeks and you see how many children had diarrhea. So this National Family Health Survey, last 1990-20, showed 9 to 20% in the last 2 weeks had diarrhea. And now, since I'm saying the prescription rate of ORS is less, Dr. Anil Arora, what do you think is the way forward? We knew ORS as the wonder drug. But they are not being prescribed. So what is the way forward to tackle this morbidity, mortality issues?
Thank you, Neelam. Thank you, Ritika and Himani, for having me on your show. I think Dr. Govind and Dr. Mohan have given a beautiful description of distinction between the type of acute diarrhea in adult and the pediatric population. There has been an excellent study recently published from this institute called SEED, as well as from the Microbiology Institute from Amity University, in which they have looked at the trajectory of mortality and infection over the last 30 years, that is from 1990 to 2020. And they have clearly shown that the mortality because of the acute diarrhea is at extremes of ages. It's just like what happens in COVID. So above 60 years or above 70 years, you will have more mortality, and less than 5 years, you will have more mortality. So you have to look into the replacement of the fluid, both in the vulnerable population in the elderly as well as in the childhood. You people as pediatrician, you are the lead head in that field, Neelam. You should realize that it has been very well propounded and very well taken forward in terms of ORS supplementation for the children, but nobody has looked at the same aspect in adults. I don't know, I'll ask Mohan and Govind, have they ever prescribed ORS to an adult? Because adults have a different ball game. Only vulnerable people with poor immunity will succumb to diarrhea. Short of that, most of them will need to be put in the hospital, those who are running fever and have a persistent diarrhea and would require intravenous replacement. That is the reason as an adult gastroenterologist, we hardly ever prescribe ORS. And in the pediatric age group, you just cannot do without ORS. But believe me, it's not a question of only writing. But if you look at the total data which you collect, like 70% of the practice of diarrhea is in the private sector. And I don't know anybody from the private sector would ever be submitting the data to the public health services to document what is the incidence of infection, what is the type of infection, what is the duration of the diarrhea.
So basically, what was done for panel was they actually took the prescriptions that from doctors, whatever the prescription. So even what we want to emphasize is, even if you would have said verbally ORS, it doesn't matter, but the documented word ORS on the prescription of the prescriptions that were taken from doctors, government, private sector, they do not write the word.
Sure. Most of adults as us gastroenterologists would be prescribing plenty of fluids, but that may not be getting translated in true letter and spirit onto the paper, which is analyzed by the health service.
So if we can add one point here. Add a point here.
Yes.
So this is taking Dr. Arul's point further. So the patient with acute diarrhea will not come to us for sure. They will not come to gastroenterologist, or they won't come to AIMS or Gangaram or for Dr. Mohan's big clinic. They will go to primary healthcare center, secondary healthcare center. Only some who are complicated by renal failure or complication, they will come to a higher center. So therefore, none of us will ever see acute diarrhea unless in your close family or close relatives. The most patient will not come with acute diarrhea with you in 3 to 5 days window, because to see also will take time. You can take appointments, other things also. So very important that at primary and secondary care center, even children and adults, if they have diarrhea, ORS is the key message. Not antibiotic, but ORS is the key. If not available, ORS, make sugar and salt in the water, but that's the key. That's a key message.
Right. In fact, there was a message given by most, like there is a lot of errors made with sugar salt. So for the last few years, WHO in their guidelines say that, at least for children, I'm talking about, that because there were errors in making, and since ORS is so cheap, they expect government to make it available in all centers. But yes, what Govind said, a glass of water with a pinch of salt and a dash of sugar, that is what we've been talking about. Ravi ji, coming to you, since he said, and you've been heading this thing, what are your thoughts, how you should be able to change the mindset of, the doctors, whether primary healthcare and secondary? What is the magic band that you want to suggest? Because we know that you have to use ORS. What is that magic when you would want to suggest us? Is Ravi there? Okay. So anyway, so we were talking about the ORS and the status, and Anil highlighted that the use of ORS, though we have it, but people are using alternative, and therefore you end up with this electrolyte and renal, and in children hypernatremia, all these issues could be due to wrong making.
Can I just highlight one important point? Dr. Govind had such a high power in powers of Achille on the society. Why is it that we keep prescribing antibiotics all over the world? They are available across the counter without prescription. Shouldn't it come from the government that the use should be restricted? Now, if you look at the analysis of the prescription which are prescribed to the adult, almost majority will be getting antibiotic. So there is no point of our guiding them. Why shouldn't there be a restriction? I think Govind can take it forward. Why should any antibiotic be available without doctor's prescription?
Correct. I think this I will talk about this, and that's a very important, the future point that you took it now, is how we are going, because we've started more of this missions in India in 2014. I think 2014 was a very turning point in India, where we started the Swachh Bharat mission. Then we started the Indradhanush mission. Indradhanush is talking about the vaccinations, and we included rota vaccine in the national health, because we realized that viral vaccination, rotavirus was the commonest cause. Though there is debate that the efficacy of rotaviral vaccine could be to the tune of 60 to 70%. But what is said is that because the burden of India is so huge, and it was the fifth leading cause of with 1.4 million, and then came down to 1.2 and 1.9. We thought it would still, the experts believe that even if it was 60% efficacy, it would be a turning point. And from 2014 onwards, and then even the rotavirus vaccine gradually, and we are among the 100 countries in the world which are using rotaviral vaccine to, we're manufacturing it at us. There are two Rotavac and Rotacil. So we are manufacturing in India and using in the UIP immunization program, which is, I think, a big step forward. And this, and having said that, Govind, have you heard about the JAL mission, and your thought about, do you think we need to talk more about the JAL mission also when we are discussing about diarrhea?
Absolutely. Absolutely. Look at the cause of diarrhea is water. Virus, bacteria, parasites all come through water. Not only water, but water, even water is good, is the hand hygiene. The two key things is, or three key things. One is water,
so
hand hygiene,
short,
and sanitation.
Can you use the right word which WHO said?
That's called wash. That wash is a simple term. We understand wash, but it's a key term. Water, sanitation, and hygiene. Water, water, sanitation, and hygiene. And the three key things, if you follow, we can prevent a lot of infective diseases.
Dr.
Not only this,
hand washing.
anymore.
Taught us. Can you tell me how should you wash hand?
I am sure, Neelam, you would have been very well aware of recent multiple videos. Govind must have seen it. But
Anilji, I can demonstrate very quickly.
Please.
First you catch water, put soap, and wash like this. And after you wash like this, then take the soap on the back, and then interlace and do it on the back. Then interlace, do it in the front, and then do both your fingers that you have to clean like this. Then you have to clean the root of the thumb. And then, also the tips of the fingers, you have to wash like this. Then with the hand for the wrist, like this, and then final wash. And then dry.
So people, please, you should replay this video. You thought washing hand is, so Mohanji, why should you use soap? What is the role of soap and what is the role of water? Not in terms of COVID. For diarrhea also, why should we always wash hands?
Of course, we can carry bacteria in our hands. So that is why educated mothers who were doing cooking at home and who used to wash several times, like on an average, a mother should be, who's taking care of 2 kids and also in the kitchen. 30 times the mother will have to wash her hands with soap. That's what the statistics say. Unless otherwise you wash with soap, the bacteria are not going to go away. And again, we don't use tissue paper while we use the toilet. We use water to wash. And then your hand will have, after you pass motion and come back, there'll be bacteria in your hand. And you just wash with ordinary water, go and cook. Immediately that will be transmitted. The chutneys, the salads, the juices, all the, the unboiled things that you make at kitchen, and all the pani puri stuff, everything will be in trouble.
How should you dry your hands, Anilji?
Yeah, tell me the type of hand washing which Mohan just demonstrated. You think it is feasible and practical once you are having, multiple snacks, 3 to 4 meals in a busy practice or in a busy routine day-to-day practice? Are we not complicating things? We have to be honest. We have to be practical. That is the reason, as I think Urvashi said in the previous discussion, if we are just trying to force our, in the our science based on our own imagination of the on the people who just do not even have soap and water for their basic needs of the life. So is it possible to do it 4 or 5 times a day, and especially after taking care of the baby, cleaning his nappies, and then trying to do it before
That's
breastfeeding?
what we have
That
to
will
do.
be 10 times a day. Is it possible ever to wash it like this? Govind would like to answer that.
That is what we have to teach. We have to teach something basic. And I totally endorse Mohan that we have to start with wash. And this initiative was taken by WHO in 218.
Is it possible to do 10 times in a day in India? That is what I want to know. That is the reason we don't. Because ultimately, as you very rightly said, infectious diseases are directly related to the development of the country. The basic need is you need to have a potable water, you need to have hygiene and standard of care. As your prosperity increases, your infection decreases. So let's not thirst this thing 10 times. You
What is
like this,
what is your
run away from your
thoughts
education.
about how to wash and dry? What are your thoughts?
Yeah. Govind, you like to answer that?
No. Anilji.
Okay.
And Neelamji, I would like to add on to the message which was given by Anil. 6 crore Indians are deprived of water by Niti Aayog. This is 2019 statistics from Niti Aayog. So 6 crore Indians do not have potable water. So 20 liters of water is required for this 30 washes, minimum 20 liters. So where do we go for water? That sort of a wash. Unless you have a wash basin, how can you do this in the rural areas? All these are challenges. But at least before you cook, at least 3 times, 3 meals you cook. No, those 3 meals at least wash with soap. That is the basic minimum that you can do.
See, for a baby born, what we say is whenever the mother is changing the diaper, she has to wash the hand. So if in a smaller baby, the diapers may be changed as frequently, diaper means nappy, whatever, is 6 to 8 times, then you will have to wash your hand that many times. And always before meals. And I think that you have highlighted very well. And that was the key message. So now, when we talk about sanitation, wash, water you said, and the issues. Sanitation, what did we do for sanitation in India? Any one of you, Anil or Govind, sanitation ke liye India ne kya kiya?
See, if you look at, again, this boils down to your basic development, your basic GDP, your capacity to manufacture and prosperity. See, even if you see today's, so the government on how many of us will drink the tap water? Still you bank upon the AquaGuard, you still bank on triple filters, still you want to boil it. So that onus lies with an individual. So this is a humongous country with so many other problems.
So we can't complain what is there. Let us see what we can do.
Absolutely.
So what is your message? How to drink water? What is your message?
First of all, never make all efforts to take the water from home. Do not believe the water which is available on, say, the outside vendors. Always try to have a water which is boiled. Recently, you would have seen there are houses in which you have a contamination of the water with sewage disposal because the pipes of the sewage lines have been laid down about 20-30 years ago, and there is an intermixing of the two. So ultimately, it boils down. Every time you drink water, try to take your own water in the hospital or wherever you are working, and try to drink the water which is preferably boiled at home, so far as you can avoid it. Outside water, you should make all efforts to avoid it.
Yes. So basically, Govind, between the, you get a lot of people from districts like, I practice in Haryana, wherever. They ask me, can we use the pump water? What do you suggest for that? Can we use the river filter? Or can we just use boiled water? Some suggestion by you?
I think it can, again, all boils down that as clean as possible in your circumstances. Everybody may not have the RO, everybody may not have the filtered water supply, but in our own circumstances, all over the country, each one of us. That's what this seminar is for, that increasing the education of people. What is the ideal? But ideal may not be achievable.
Then
but less than that ideal, less than that ideal. We can always talk of scarcity, but certainly there's a big country, there will be a scarcity, no doubt about that. But again, how do we do better in that scarce situation? Now, coming to the question you asked, Dr. Neelam, that which water do I drink? So question always comes that if you're taking pump water, and if pump water, most people will brew even in rural areas, but if you boil it, it becomes further better. Because so boil it for just 1 minute and keep it for the whole day.
Ideal, at least try to boil and at least try to do that for the extremes of ages, which Anil was saying, who have a very high risk of this thing. And we've talked about the basic things which make an error, this poisoning, food poisoning, diarrhea, infections, all that are seen in adults are not necessarily, there's so much that you can control. So we've discussed about rotavirus, which is very common in children. Do you see rotaviral norovirus in adult? Dr. Mohan, what is the incidence of viral diarrhea in adult? What is the etiology in adults?
Some of the common etiologies are bacterial. Mostly, we have coliforms like E. coli or, like sometimes Salmonella. And Shigella and all this, Salmonella, Shigella, they sometimes, start as an enteritis and then go on to colitis. So that there is a watery diarrhea at least for 1 day, and then it becomes blood and mucus diarrhea. That's what we commonly find. And what I commonly find in South is Giardia diarrhea, parasitic diarrhea. Giardia lives even in well water and borewell water. There also you can get.
But I want to give a message that if we take the data nationally about in India, the indication of Giardia in children is not even 1 to 2%. So we do not suggest metronidazole to be used because the incidence is very minuscule in children. We say that it is viral diarrhea, wait and watch. Indication of antibiotics is when there is bloody diarrhea. Do not use over-the-counter metronidazole and all because we don't see Giardia in amoeba. So that was one message. Now, Anil, I want to say that we said the burden is in children. I mean, all of us, you're an adult gastroenterologist, but everybody is a basic physician. And as a basic physician, there are a few things which all of us need to know basics as help. So what is it that you would want to give a message that in terms of diet, in terms of some vitamin supplements, which have shown to have an impact in reducing the burden of diarrhea, in reducing the severity? Would you like to empower our audience about what, whether in children or in adults, diet and nutrition and vitamins that you would want to talk about?
Before answering that, Neelam, I'd just like to comment on the etiology of the adult diarrhea. Surprisingly, there are very few good quality studies. The major reason is most of the diarrhea in adult is self-limiting. People tend to self-medicate, and then even if they go to the physician or gastroenterologist, they are given antibiotics. So I was talking to our own microbiologists, they hardly get any stool samples for evaluation of the acute diarrhea. Having said that, there is a good publication from GTV Hospital in which they have analysis of 2,300 stool samples sent to them for analysis of acute diarrhea. Majority in the children, but about 30% of the adults. And their analysis was that viruses practically are not the cause in adults as compared to the children where rotavirus is common. The only situation in which adults will have a viral diarrhea are the patients who are immunocompromised, who are on renal transplantation, where with this facility of so-called rapid biofire, you tend to isolate viruses like adenovirus, rotavirus in that subgroup, not in an immunocompetent adult. And amongst adult, as Mohan very rightly said, commonest infection are Salmonella, both typhoidal and non-typhoidal, Shigella, ETEC, and cholera of different varieties, usually Ogawa type of variety. Coming to your question of what will be my advice will be try best because of the limitations, as Govind very rightly said. You cannot depend on the government to provide you good potable water. And second thing, Neelam, we should understand, when we are eating food, you should understand food is coming in front of you. Have you ever traded back as to where it is coming from? Has the guy who's been serving you the food been educated about the hygiene? The person who gets the raw material, has it been washed properly? Is the washing water good enough to wash the vegetables and fruit, or to wash even the salads? All that will contribute to the occurrence of the diarrhea. So my advice will be, unless you are sure of the hygiene of a particular place, try your best to eat only the hot stuff which is cooked freshly. Anything which is stored and stale, especially at this temperature, at the temperate climate of 45 degree, which is hovering around in Delhi, you are very likely to have not only the infection, but also the preformed toxins like staph, which are the common causes of acute diarrhea in adults. So make all efforts to eat at home and be very clear that you do take only the cooked food outside.
Arvind,
and we should also praise the people who are giving you the food, your maids at home, the servants in the restaurant, and all that chain is so important for preventing the infection.
So what I wanted to ask Govind is, when I asked about vitamins, do you think like zinc in diarrhea is any role, Govind?
I think zinc has a wonderful role in children, and studies in children shows that if you give zinc, you can decrease severity of diarrhea by about 1/3, both duration and severity. So zinc in children is wonderful, and there are great studies from our own country, many centers. So zinc in children is wonderful, but in adults we have limited data and we don't practice that.
So actually, absolutely.
Neelamji, also adding on
one message, that 20 milligram of zinc in children, along with ORS, is the way forward. It not only reduces the duration of diarrhea, but also prevents you to further episodes of diarrhea as well as respiratory infection. Most of the people in India are zinc deficient because our eating habits are those. We don't, I mean, majority of vegetarians, and also the soil is deficient in zinc. So therefore we face this problem, but that is a key message: ORS and zinc, and no to antibiotics. Mohan, vitamin A, do you think nationally we should focus on vitamin A and its impact on diarrhea?
Yeah, absolutely. Because even giardiasis, one of the most rampant infections, can produce a fat malabsorption, can produce a vitamin A malabsorption. 30 years ago, I published a paper on this, that probably injectable vitamin A is the way forward, not even the oral vitamin A, because of the malabsorption issues which can be there in children with chronic diarrhea. In children who do not have chronic diarrhea, then you can go in with vitamin A. I'm sure vitamin A is also protective. And deficiency states are well known in children. I think
so basically what we say, therefore the government has adopted this. Less than 6 months, we don't have evidence, but from 6 months to 5 years, we have shown that we reduce the morbidity and mortality. So we do. Now we are almost coming to the end of the summit. We started a bit late. We have last 10-15 minutes where I really want some brainstorming from all of you all, that what is the way forward? How would you like to brainstorm? So Dr. Anil Arora has been saying the government has to provide water, government has to do. So short of that, do you believe in something like what can I do? Each individual can think the role of public-private partnership, role of NGOs, role of stalwarts like Dr. Anil runs an organization, Delhi organization, you run, Mohan run. So what is the role in which these NGOs, public-private partnership, individual, how can we contribute according to you in achieving the goals? Because we have talked about, why was this Swachh Bharat? Swachh Bharat was, of course, we celebrating Mahatma Gandhi's anniversary. We started the Swachh Bharat mission in 2014. And the purpose of it was everybody should have a toilet and there should be no open defecation. If there is no open defecation, then your feces, your water and increase. So your take on that, on open defecation, Govind, why did we focus so much on Swachh Bharat, about this toilets?
I think this is the basic fundamentals. We talked about it. Wash. That you have to have a sanitation. Open defecation will contaminate your water source and water bodies. And therefore, so these are the preventive measures any country would like to do. And this is a wonderful thing that we engaged ourselves into this kind of mission, not only individual, but country mission that we have Swachh Bharat. I think this is two things happens. And I think as an individual, as an Indian, I believe very strong in this, that, okay, this is a strong movement, but also this provides that you connect one to one. The whole country like one, like you feel the whole country is one. It's like, that's, I think this is more stronger that you participate in the Swachh Bharat. There is your personal hygiene, your own responsibility, but at the same time you connect with each other.
So I think that's a very important mission where each of you, and I was asking about public-private partnership. I want to know from Mohan and Anil on that also. Besides the government, what public-private partnerships you think will it work and how?
I think, we have the responsibility also because government can, with their limited resources, can do only to a certain extent. I think we have to, as public, as doctors, and also the NGOs of this country should join hands and then take this message across the country to the nooks and corners of this country. In fact, we used to observe Swachh Bharat mission. I have done human chain with 3,000 school children and things like that. Like give pamphlets. I walked into slums and explained to them about the water, hygiene and sanitation. See, really should thank this movement, because what was open defecation free, even though 100% we are aiming to be open defecation free, we are today the rural areas have, the open defecation is seen only in 0.8% global, the pan-India statistics, whereas it was 68% among the rural population in 2017-18, which came down to 23% in 18-19, now it is 0.8. That means the Swachh Bharat movement is working. So we need to, as part, because see, for example, Rotary has taken up to wash program, has taken to all children, to all schools. Like one district has got something like 70-80 Rotary clubs, and the Rotary clubs take this message and go to schools, teach the children how to wash hands. What about the hygiene? Why is it required? So this sort of NGO-GO partnership is of paramount importance. We have to stop polluting our water bodies. That is one thing which I wanted to say. In Tamil Nadu, like the ancient Chola inscriptions 5,000 years ago, what they put it was that there were 3 water bodies. One was Uruni. Uruni means people take drinking water from that source. The other one is called Kulam, where people take bath. And the last one is Kuttai, where they wash the animals. So all these 3 were separated. Today we are polluting all our rivers and water bodies, which we have to stop doing. Then only, we can prevent waterborne illnesses. So that is the message, I think, which definitely we can all together.
Well, what is your message today on this Hand Hygiene Summit? What would you like to tell the audience beside the public-private partnership and role of NGOs, etc., that Mohan talked about?
Yeah, I think Neelam, it is a very good initiative on the part of this organizing committee, not only to educate amongst our own group, but also all the stakeholders. You should remember, if you go back home, 9 out of the 10 times you will not be cooking. Somebody else will be cooking for you and you'll be eating the food. And you go back and trace back the trail of the people who have handled the food. Even if you're washing your hand, doesn't matter so far as the food is contaminated. I think a repeated attempt for educating all the stakeholders that onus lies on you as physicians, as gastroenterologists, as RWA members, as Lion Club members, as Rotary Club members. The more awareness we spread, the more will be the prevention from these so-called preventable diseases. Till the government is able to get you to a level of prosperity where people are educated, where people have the resources, where people have enough of water and soap to wash their hands. And by default, if you see, compared to the Western world, these things will automatically go down. Till then, if you boil down to your own self as of now, with limited resources, boiling at home is the best way to get out of this ruckus for the time being. And if you want to talk to me about future, I think we have a brilliant person, Dr. Govind. Dr. Govind, if you remember, like in COVID, we had an umbrella. Neelam would remember, it was a corridor. If you go through that corridor, it will irradiate you for the COVID. Similarly, can I ask Govind, can we have your thali going through a umbrella which will just neutralize and deactivate all the protozoas and bacteria and viruses. So if it is available, doesn't matter who has handled it, and then you can eat it. Maybe Govind can do some basic research on that.
Like Govind, besides that, so they talked about, is there any other message today for our audience that you would want to give? And something for future, some ideas you think that should be adopted besides what I said to you, foam. We started with an Indradhanush where we looked into rotaviral vaccine. We started with Swachh Bharat Mission. We looked into the sanitation predominantly. I think the Jal Mission is not taking too much, and maybe, I don't know whether you would agree, the focus should be by the government something on the Jal Mission improvement and this. What is the other way you think you can suggest the government to move forward in this direction? What is your thoughts on that?
Again, Neelam, let's go to fundamentals. If you're talking of diarrhea for today's panel, then diarrhea is mostly acute. If acute diarrhea, most are preventable. Again, the basic remains that we have to wash, that is water, safe water, personal hygiene, and general hygiene, hand washing. So if you have three things done, and we have more and more people come under this umbrella, this will be wonderful. It's about educating more and more people rather than complicating the stuff. It's as simple. We can do many more things, but we reach out to more people with these simple three ideas of good water, personal sanitation as far as possible, and hand wash. Three things to more people. I think whatever is required to be done, that should be that's ideal thing to do.
One question I want to know: post-COVID, did you all see less diarrhea? Did people become more conscious about washing? Or it's too early, but do you think, Mohan or Anil, if you all think in the last 1 year or 6 months, do you think is it better? Though there is no data,
In fact, my own observation is the number of diarrheal episodes have gone up, whether it is because of stress-related IBS or poor immunity, or because of the use of the steroids or antiviral drugs. The incidence of infection has gone up. There is a direct involvement of the GI tract by the diarrhea. I don't think hand washing has prevented the occurrence of diarrhea in COVID post-COVID.
Yes, I think that's what most of the data is suggesting. And I think it was really, really lovely. I would like to thank the organizers for giving this opportunity to me. Though we started late, but I would like to sum up with the key points which my panelist gave. And I had Dr. B.G. Mohan, Dr. from Coimbatore, Dr. Anil Arora from Sir Gangaram Hospital, Dr. Govind Makaria, gastroenterologist, all three of them, and Govind from AIMS. And I am Dr. Neelam Mohan, a pediatric gastroenterologist. And I'm happy to share that though I'm working in the private sector at Medanta, but I've been very instrumental I've been an advisor to the National Authority of India, and we were making for the last standard work treatment flow charts. I was responsible for making a standard flow chart nationally for diarrhea. And this was an endeavor which was started by ICMR and Niti Aayog, and we wanted that to be in each public health center. And to prepare one page, it took days with experts all over. They were government and private sector collaboration, because we need to understand that to achieve in life, especially in health in India, we both public and private have to come together, because the public sector caters to 30-35% and the private sector caters to 70%. So just a separation will not help us. We need to come together. Second, we need to understand that besides the government, we need the private sector also, which is public-private partnership, NGO involvement, etc., to address this basic issue with especially the CSR becoming important in our country, where each company has to give their CSR for such purposes which they can use through the NGOs, etc. So that was what was made me very much interested in diarrhea. And I'm also happy to share that working at Commonwealth Ministry, being a president of Commonwealth Pediatric Gastroenterology, I'm working with all ministries of Commonwealth. And can you believe it? These are basic things. And what we realize is it is never the hi-fi stuff that we want to, which is a magic wand. The magic wand is always simple education. Education and ignorance in the people is what is responsible for majority of the morbidity and mortality, especially in a case like diarrhea. So my panelists wanted to educate you on these 5 messages in your hand. Number 1, they talked about the hygiene of your hand and properly wash your hand. Number 2, they talked about the safe water, how you can use the water, whether you want to, ideally, if you have an RO, etc., and next to it, you want a filter, you want boiling. So they emphasized about that. They talked about the chain of contamination where it happens. And one of my panelists, Anil, insisted that not only children must carry water bottle, probably adults must also now think about carrying the water. That was one of the second messages that we said. Then we talked about the third point, which is the food. Food hygiene is also very important. So hand hygiene, water, food hygiene. And we talked about the sanitation. Sanitation is trying to, and it was really a delight to hear from Vimon that the Swachh mission, which we started in 2014, did take off beautifully, and we reduced the open toilet defecation with the advantage of so many like Tatas, etc., organization coming and using the CSR activity. We reduced it from 60 to 0.8%, and that was a very good step that we took. And last and not the least, 5th point, which most of the panelists highlighted, is no to antibiotics in children. When there is diarrhea, you do not need antibiotics. All that you need is an ORS and zinc. So this is what the entire panelists were trying to focus on. And they all believe that education is the way forward. And we all want the doctors to be involved in various ways, even if we have to keep repeating. But sometimes when you keep repeating, the acceptance gets beautifully. And we are all grateful for this opportunity that was given to us. I would request for a group photograph by the organizers before we end.
What a pleasure it was to listen to Anil and also Govind, and what a lucid summary that you gave, Neelamji. And my hearty gratitude for pulling me in. I learned a lot today. Thank you.
Right. So I'm not sure whether they would see.
Yes, done, ma'am.
You've done. Thank you. Sorry, you take it.